get to it. So if everyone would just download these 3 files, that'll be what we'll be working off of today. We may not get through all of part 3 today. That'll be just fine. Okay, how's everybody doing?
Good, thank you. And yourself?
Good. Yeah, doing well. Busy. I just started up a clinic here in New York. I've mostly been a traveling clinician for a number of years, so just started up a clinic here in New York, and there's a lot of demand these days. So I've gone from no patients 6 weeks ago to about 15 patients a week, which is pretty quick. And that's been good, but it's certainly keeping me busy. I think we're all set up here. Let's get that angle a little better. Anyone have any questions from last week before we start off? I got a couple of questions and emails from people, but if there's anything lingering or anything bothering anybody, let me know. Good, week 1 made. Or go ahead.
Sorry, just to clarify
please.
about the chart. There wasn't anything to turn in though, right? You just want.
I would like you to email me the chart filled in.
Okay.
Yep.
I haven't yet. Is that okay?
That's okay. Just get it to me by like an hour after the class ends.
Perfect.
So you don't have to be doing it during the class here. I'm also noticing people have done substantially better on the chart than normally in person, which is very impressive. Clearly, you've all been studying very hard. I would make sure that this chart might seem silly at this stage. It is quite important. So make sure you're very comfortable with it. All right, thanks for the question. Okay, so we're gonna be starting off. Just a little bit of a recap of last week. Again, these slides are both on the Slack and in the chat. There. So stop me at any time if you got questions, and we're just going to dive right into it, all right? All right, so we don't really have a quiz, so schedule for today. You've all done the quiz at home. I'm sure most of you have already sent it in. For anyone who hasn't, like I said, you've got until, let's say, 1 p.m. today to do so, no problem. We're gonna do a little bit of a recap last week. We're gonna move pretty quick through that, but if people have questions, please ask them. We're gonna talk a little bit about what heuristics are and how to think about Chinese medicine as a heuristic system, and then compare that to the Western medical heuristic systems. We're going to touch on a couple of classical metaphors for thinking about the body. So talking about the body as a walled city or as a governmental structure. Back in old China, when the court physicians were trying to explain to the court how Chinese medicine works, they used metaphors that the court would understand. So they talked about it as a court. We still use those metaphors today. We're going to talk about the 3 different types of disease: internal, external, and miscellaneous. That's just a broad overview. And then we're going to start talking about external disease, and we'll see how far we make it into that before the class ends today. We're still going to be relatively abstract. Again, after the midterm, we're going to ground down into just very clear factual stuff. Everyone can see these files? Anybody having trouble with that? Good. All right, so quick review. So everything we're doing is going to be rooted in yin and yang. I'm not necessarily going to be bringing everything back to yin and yang, because if I do that with everything, that's all we're going to talk about. But as we're going through the entire semester, I want you to remember that this is the ground floor of our philosophy. This is what everything is based upon. So if something seems to not fit, one of the questions you can ask yourself is, how do I think about this in terms of yin and yang? The 5 elements are an example of yin and yang played out in a slightly more complex manner. And a lot of the translation stuff is hard. So when you're looking at concepts that seem familiar, keep in mind that they may be less familiar than they appear. And when you're looking at concepts that seem very different because they're still in Mandarin, keep in mind that if we were to translate them, they might appear more familiar, but they aren't necessarily more familiar. That's most of the week 1 review. So let's talk about heuristics. I try not to read from my slides too much, but we're going to do it with a couple today. So a heuristic is any approach to problem solving that employs practical method, not guaranteed to be optimal, perfect, or rational, but instead sufficient for reaching a goal when finding an optimal solution is impossible or impractical. People who take the concept of heuristics very far would argue that most of what we do in the world is our heuristic systems. So this would be, if you're in mathematics and you're trying to calculate the circumference of a sphere, you're going to be using pi. Well, you're going to be using pi to what level of decimal points? No matter what you're doing, you're going to be simplifying it to get an answer that is perhaps not perfect, perhaps not fully rational, and perhaps not optimal, but is sufficient for whatever you need to do. If you're working in medicine and you're trying to calculate the width of a tumor, you're not going to be going down to nanometers. You're not going to be getting the exact right answer because it's unnecessary to do so. So we're going to use systems that get us answers that get us to the goal we want, not necessarily systems that give us a true or perfect answer. So when we talk about Chinese medicine, what is it that we're trying to do? We're trying to help people who have a problem related to health. I remember having a patient who ended up being a psych case for a while when I was an intern at Pacific College, whose chief complaint was that they needed help writing their resume, and they had come to an acupuncture clinic for that. That would be an example of someone whose problem doesn't at first appear to be health, but on closer examination very quickly is. We judge a heuristic system, a way of thinking about things, by how close that system gets us to the goal. If our goal is to have people be healthy, then the heuristic is as good as it gets us to that. We're not judging it based on how rational it is, how perfect it is, or how optimal it is. For example, we could have something that makes people healthy every time, but it costs $1 billion and it takes 1,000 hours of work to get people there. Well, that might be perfect in some sense. It's not going to be optimal. The cost associated with it is going to be too high. So we have to balance multiple factors to figure out how much work we want to put in to figure out how to get a person to health. Chinese medicine is a system that has been taking this into account for a very long time. So if this semester is largely going to be about disease, and if we want to talk about disease, we have to talk about health. What is health? And if we want to talk about health in Chinese medicine, the easiest way to start within this culture is to talk about what it looks like within Western medicine. On the one hand, it might seem like talking about the Western medical philosophy is a little bit unnecessary, but it's what we've all, at least most of us, have grown up with, what we're familiar with. This quote from David Foster Wallace I find helpful for thinking about this. So there are 2 young fish swimming along, and they happen to meet an older fish swimming the other way, who nods at them and says, "Morning, boys, how's the water?" And the 2 young fish swim on for a bit, and then eventually one of them looks over at the other and goes, "What the hell is water?" As we begin talking about Western medicine, a lot of the concepts here might be concepts that have not been thought about a lot by many of you. Some of you with a Western medicine background, this might be very familiar, but it also might not be. Often medical philosophy is not really taught when doing Western medical training. Even if these concepts are concepts you're familiar with, when you're talking to your patients, they're going to be assuming most of these things. So before we go any further into talking about what is Chinese medicine, we got to start with what is health and what is disease. This is a great, in my opinion, sculptural piece on a hospital. I think this is in Philadelphia. I'll double check. Might be wrong. I think of this as a wonderful representation of, with the exception of some of the past 10, 15 years, the main thought process behind much of Western medicine. The goal is to prevent death and keep death at bay as long as possible. So within Western medicine, health is a relatively amorphous concept. What it means to be healthy is a little bit hard to define. Disease seems relatively clear, but outside of the binary yes and no diagnoses, like, yes, you have this biomarker that tells us that you have this disease, we can check your blood, we can compare it against a baseline range, and we can tell you whether you're in or out of that range. Yes, you have antibodies to this particular virus, therefore we know that you have at least been exposed to it. A lot of those give us binary yes and no answers. But outside of that, we have a very large gray area. And that gray area is often talked about within Western medicine, but often more at the theoretical level. So some of this gray area is going to be defined by arbitrary or statistical boundaries. And some of this is going to be somewhat swept under the rug. So the question here is, when is depression a disease, for example? The DSM, the Diagnostic Statistics Manual, will tell us that depression, clinical depression, is determined in part based on time, how long the patient has had it. Someone who exhibits all of the signs of depression for one day would not be considered to be clinically depressed. In Chinese medicine, they probably wouldn't be either. The amount of time that you need to be depressed before it's considered something that needs to be treated has changed between different volumes of the DSM. This reflects the idea that it's a little bit fuzzy. What is depression and what isn't depression, or at least what's clinical depression and what isn't, is up for debate and changes over time. It's got a fuzziness to it, as opposed to, say, you test positive for corona antibodies. We know what that has a much clearer indication, assuming the tests are working well. So oftentimes this means that disease is defined, that health is defined as a lack of disease. As we get to Chinese medicine, I hope it becomes clear that we think about health differently. So the gray area. Can things be objectively measured? If you can't put it on a scale, it's hard to talk about it. I'm sure everyone here has seen examples of pain scales when seeing a doctor, or even within television, 1 to 10, different faces given. We have all of these different standardized ways of measuring the subjective, but oftentimes it's up to the patient to determine what those subjective measurements are. So we have, I'm not going to get too specific here. If we're talking about pain, we have many different standardized methods to look at. If we want to run a study on whether, say, acupuncture treats low back pain, we run into the problem of, well, how do we define how bad people's back pain is before and after? Got a couple different metrics we can work with, but they're not objective, they're just consistent from one patient group to the next, because we don't have a good way to talk about these things. When it comes to psychosomatic issues, we've got a lot of gray area. So we'll come back to this in a little bit, but globus hystericus or globus pharyngitis, the sensation of something stuck in the throat that can't be coughed up or swallowed, that gets worse with stress, emotion, or anxiety, would be a good example of a psychosomatic disorder. Some people have this so badly that it ruins their life. It represents something like 15% of new ENT doctor admission consults, ear, nose, and throat doctor consults. Patients who have this, it can be completely crippling. We don't have a way to think about it within Western medicine. It's considered completely in the head. After you rule out things like throat cancer, it's considered to be a side effect of an anxiety disorder most of the time. The gray area also contains things that I call patchable disorders. So that would be low energy. Well, we can give you stimulants for that. Anxiety. We've got all sorts of, basically a large amount of psychological disorders fit into this patchable category. Low energy, we have stimulants. Can't sleep, we've got sedatives. These sorts of things where we don't really care too much about solving the problem at a root level, in large part because that's not necessarily believed to be doable. Instead, we have ways of just removing this from the experience of the patient and therefore on a certain level curing it. If the patient doesn't experience the problem, then by definition, they don't have it, if it's psychosomatic in the first place. Is kind of the thought process that's going on here. Before I go further, there's no bashing on Western medicine in anything I'm saying here from my perspective. So if any of this sounds like that, stop me and ask a question. I'm a big fan of Western medicine. There are things that they're very good at. There are things that they're less good at. Same with Chinese medicine. So as we're talking about these conditions, I'm going to be highlighting things that Western medicine is bad at. I shattered my leg at the end of last year. I didn't go to an acupuncturist. The Western medicine practitioners did a wonderful job. So if this feels bashy, that's only because we're focusing in on the areas where there's some issues. A good example of things that fit into into all three of these, objectively measured, maybe psychosomatic, and maybe patchable, is basically any disorder within Western medicine with the word syndrome at the end. There are a few exceptions. So syndrome is defined as a group of symptoms which consistently occur together, or a condition characterized by a set of associated symptoms. I'm going to translate that as, we know this is a thing. We know these things happen together, but we don't have a reason for the why of why they happen. We can point to, okay, patients who have metabolic syndrome, which would be weight gain, high blood pressure, potentially diabetes. We can take that and we can say, well, a lot of those patients also have high stress jobs and they have certain eating habits and certain exercise habits, but how those two bridges exactly cross isn't really well known. Often once we have a mechanism, we also begin to have a way to treat these things within Western medicine. But as long as it's still a syndrome, Western medicine tends to have difficulty doing anything other than patching these conditions. So chronic fatigue syndrome would be a good example. We know this is a thing. Enough people have come to the medical establishment reporting this cluster of symptoms that we know that this is a thing that we can label, and then hopefully we can study. But outside of stimulants, and in some cases, we're looking at hormonal issues when we're talking about chronic fatigue syndrome, but outside of a few patching solutions and a few types of diagnoses we can relate to this, we don't really know what to say about it. So this is the basic way that disease is going to be approached within Western medicine, and we're going to contrast this to Chinese medicine in a minute. We want to find a discrete diagnosis, give the treatment, resolve the disease, and move on. So if a patient comes in with a bacterial infection, we culture the bacteria, we figure out exactly what they have, we give them the appropriate antibiotics, the bacteria gets better, the bacterial issue resolves, or it doesn't. If it resolves, then this case is closed and we move on. There's not a lot of room for complex diagnosis when the patient's problems are small. A patient comes in with a headache and insomnia and ankle pain and mild depression. We're not going to get much further than, okay, well, how do we just patch each of these things to help resolve it? Lisa Sanders is the doctor that House, from the TV show House, is based upon. They don't bring her in when there's small issues. The patient at urgent care saying, like, I'm just having trouble sleeping, doesn't get the big guns, because the more complex the problem, the more complex the analysis, the more cost is involved within Western medicine. And the more complex things get, the more complex things get. Complexity breeds further complexity. And within a Western medical, scientific, double-blind, placebo-controlled study setting, it's very hard to study complexity. The more variables you have, the more things you're trying to look at the same time, the more likely it is that you're either going to have costs that make it prohibitive to study, or you're just not going to try. Or you're going to try to study pieces and hope that you can fit all of these studied pieces together into a larger concept. This making sense? The people with a Western medicine background, anybody offended? I'm happy to hear other opinions here. I know we've got a really broad skill set in this class. Where's that? I don't want to call on people with a Western medical background, but if any of you want to chime in, I'm happy to. If anyone thinks any of this needs correction, I'm happy to hear it. And I will take silence as Peter, everything you're saying is wonderful. Keep it up. Okay. So it's hard to find within Western medicine a definition of health. It's not something that's very clear or apparent on first glance. So this is kind of my take on how Western medicine defines health. When there's no diagnoses to be made, I would add to this, when all of a person's testable values are within a normal range, which everyone's normal is going to be a little different. And if you check everything, everyone's going to be abnormal somewhere. But when the issues are purely subjective, you're healthy if your problem is that you're a little more tired than you'd like to be. And you're considered generally healthy if all of your hormonal panel puts things in the right range. You check your blood, everything looks good, but you need 9 hours of sleep a night and you wake up tired. Good enough, you're healthy. That's just how you are. Maybe we're going to refer you out to someone who works with the fuzzier aspects of health, like psychology. And the last one is, you're healthy if you don't have any problems. If you self-define as not having any problems and none of them can be found objectively, then you're healthy. We're going to play out a little bit how this creates some issues. The no complaints is the main one. This is our bread and butter as Chinese medicine practitioners, because there are quite a few issues that patients will come in for, and as you start talking to them, they will say things like, I thought that was normal. So one of the ways that we can return a person to health within Western medicine is make sure that they don't think they have any problems, whether or not they do. Oftentimes subclinical conditions are going to become normalized. So if a patient has a condition that's causing them pain, discomfort, and problems, we don't have to define that as a actual problem. We don't have to define that as a diagnosis within Western medicine. We can just say, that's not something we treat. That's not something we really care about. That's normal. You're going to have to learn how to live with it. And therefore, on a certain level, you're cured. We've given you the answer to your question. There's no further to look. So menstrual pain being normal would be an example of this. PMS being normal would be an example of this. These are just things, you take some painkillers, it's fine. No big deal. We can't diagnose something, we can't resolve it. Oftentimes patients are going to come in, and those of you who continue through school and become interns and become clinicians, this is going to be daily. Half of your patients, this is going to be something that happens. Your patients are going to come in and see themselves as healthy despite having multiple conditions negatively impacting their quality of life. I would refer this back to we don't really see the water that we swim in. Now, as a quick aside, as a practitioner, it's important not to give your patients problems, but Chinese medicine has a different relationship with complexity. I'll talk about that in a sec. Key difference. Disease in Chinese medicine and Western medicine is viewed fairly similarly. You know, if we're talking about, if a patient comes into a Western medical practitioner with hepatitis and they come into us with hepatitis, we're going to diagnose them with liver fire, almost certainly. Hepatitis, if you were to translate the Greek-Latin mashup, that is the word hepatitis, it means liver fire or liver inflammation, liver on fire, same concept. We're going to diagnose that similarly. We're going to have different treatments. We're going to have different ways to look at it. I'm just going to refer them out and then try to support the Western medical approach to treating it. But in Chinese medicine, we also believe in this idea of imbalance. And this is our basic progression. Health can turn into imbalance. Something happens here. This something is going to be a lot of what the next 2 weeks are about. That turns into an imbalance. And from the imbalance, we get the ability to have something else happen and to have disease. These two arrows are going to be the focus of much of your Chinese medicine training. How do we get from this stage to here, this stage to here? And then how do we reverse that? The challenging part from a Western medical perspective is that imbalance is often subjective and often subclinical.
Sorry,
Often,
question.
yeah.
What does subclinical mean?
Sure. So subclinical, underclinical, less than clinical. So if I were to go into, I used the example of menstrual pain a minute ago. If a woman is going into her OBGYN and she says, you know, I got pretty bad pain for like 3 days every cycle, and I usually have to spend a few hours in bed, you know, middle of the first day. Depending on the OBGYN, it's very possible that they'll say, that's normal. You should take some painkillers for that. You know, here's hot water bottle. Go through the list of things that we can do, but we don't need to investigate this further. On the clinical side, the woman who has to be admitted to the emergency room and given morphine every time she gets her period, well, we're going to investigate that. That's clinical. That's a real problem. I'm not saying that to, this is the way Western medicine largely thinks about these things. If it's something that you can take some Tylenol and be okay about, why are we talking? I'm not saying that to be mean to Western medical practitioners. They're busy. I'm not going to waste my time and my diagnostic skills on trying to figure out something that we can solve with Tylenol. Whereas if it's crippling, it's different. That makes sense? Good question. Thank you for asking.
And can I also
question?
Sure.
Sorry, was somebody talking? Oh, so if we're going off of like the clients, like what they're expressing to us, and let's say the client isn't like being honest, or is just like, nope, everything's fine, and there's no signs via what they're telling us that there's imbalance, what kind of treatment do you give them?
So
Like,
we've got
just...
the answer to that. I'll give a short answer here. The long answer to that question is next semester. That's pulse, tongue, all of the ways we ask questions. Let me get a few more slides here. I think I'm going to answer this question for you at the level we're going to in this semester. But if I haven't, chime back in and just go, Peter, you completely ignored that question. Come on.
Okay.
And we'll cover it. All right.
Thank you. Thank
For sure. Okay. So that's the basic overview of some of the Western medical philosophy. There are entire semester courses on Western medical philosophy. So this is, like I said, a brief overview. But I want to say all of that to contrast the Chinese medicine approach, because if we just talk about how Chinese medicine thinks about these things, you might be like, yeah, that makes sense. It's like, yeah, but look at the difference. So Western medicine in general doesn't like subjective self-reporting. It doesn't really like patients. Like if a patient comes in and they say, you know, I get this pain that starts here, and then I get anxious, and then it moves to here, and then it moves out to my shoulders, and then my arms get tingly. A Western medicine practitioner is going to go, okay, well, I'm going to refer you to the psychologist. We'll, you know, we might check your nerve conduction. We might make sure your spinal cord's okay. If this is bilateral, we might look at your spinal cord. But in general, the more odd and subjective the patient's experience is, the less it can be measured, the more it's considered to be fuzzy and unreliable. So we're going to largely not pay attention to that. If we can't find anything that we can touch or measure, we're going to view it broadly. So the patient who has a very complex description of what's happening pain-wise and how it progresses in their body, that just becomes pain. So I've had patients who report to me this long chain of pain that goes on their body, and they say, when I talked to my doctor about this, he said, okay, on a 1 to 10, how bad is it? It's like, well, it's the story that matters. But within Western medicine, we're trying to remove as much of the subjectivity as possible. And if you can't, you refer the person out to someone who deals with the fuzzy parts, the parts that are in the brain. Chinese medicine cares just as much, if not more, about subjective symptoms than about objective symptoms. We see the subjective self-reporting of patients as consistent, reliable, and diagnostically essential. If the patient doesn't actually share their experience with us, it's hard for us to work with them. As a quick aside, this is actually more challenging in a place like New York than it is in a place like rural Guatemala, where I worked for a while. Patients in New York are often sufficiently well-trained that they're going to report mostly in the way that Western medical doctors want to hear. So I've had patients who come in, they're like, oh, I'm just going to keep running with this example. I'm here for menstrual pain. It's like, oh, tell me about it. Well, it's about a 7 for about a day, and then it drops down to a 4, and occasionally hits up 5, and then it's gone on the 3rd day. okay, well, what, stabbing, cramping, cold, hot? Do you sweat when there's pain? Is it before eating? Is it after eating? Does stress make it better or worse? Does exercise make it better or worse? These are all things that we really care about within Chinese medicine. But often people within a place like New York have been trained not to share that. In contrast, in rural Guatemala, working with indigenous communities that speak Quiche and Cachiquel, as they begin describing what they experience, I got to the point where I didn't really need the language anymore. I had to speak Spanish, but I had a translator for the indigenous languages, because they would describe things exactly like the old Chinese medicine textbooks. A noise happens and then a ball is here and then the ball moves upwards and then I get dizzy and my head feels hot and I start sweating. It's like, that's textbook. What we're reading from China from 300 CE. So we care about these subjective self-reported experiences and we see them as reliable. So starting with this one, I have a sensation that there's something stuck in my throat that I can neither cough up nor swallow, which is worse with emotion. The history of globus pharyngitis within Western medicine goes back over 2,000 years. It's very old. It goes back to Greek medicine. We still don't have a treatment for it. Chinese medicine, it's a type of insubstantial phlegm that manifests in the throat through a mechanism that I'm not going to share with you right now because it's not going to make any sense because we're at the beginning. But we have a treatment for this. It's reliable, it works well, it works fast, and then the problem usually doesn't come back. And it costs about $6. Is that globus laryngitis? Globus pharyngitis as in, here we go. I had this open in case there were questions about this. Globus hystericus is the name that I know for it. It's got a whole bunch of different names. Sensation, yeah, you can check that out for more information. In Chinese medicine, this is called plum pit chi, the sensation of a pit from food, often that feels hot, that's stuck in the throat, but on investigation, there's nothing there. Another example. I get highly irritable before my menstrual cycle with intense pain in my ribs, followed by very painful cramping and diarrhea and exhaustion afterwards. This is often considered subclinical. So, okay, we get painkillers, make sure you rehydrate and sleep well, and that's normal, and try not to be too irritable, and you're good. But that's not exactly helpful for the people experiencing that. So we have completely different ways of thinking about these things. Within Chinese medicine, a healthy menstrual cycle should be 1 hour of mild discomfort. That's it. Anything else we would consider worth treating because it's likely to lead to other problems down the road. Not necessarily related to reproductive health in any way, shape, or form. So within Chinese medicine, health is going to be made up of not only lack of pathology, which is the same as Western medicine, but also proper balance within the body. So we don't only have something that we want to not have, but there's something we want to also have. If the patient isn't within balance within their system, then we see them on their way to developing pathology. Within Western medicine, if there's no pathology, then why are we talking? I'm here for when there's pathology. Again, not trying to be dismissive of Western medicine, but that's often how this goes down. So what is balance? This is going to be a large part of your study within acupuncture school, is learning further and further what this is and then learning how to work with this clinically. Balance is balance between yin and yang, 5 phases moving between each other smoothly and correctly, the organs within the person's body communicating correctly, and their Tao being followed. This last one, not mandatory for people to learn how to do this, but especially if you're working with psych cases, then learning how to help people set up correctly in relationship to the Tao is necessary. Quick moment on organs communicating correctly. We've got diagnoses where If you remember from last week, we reviewed the production of qi, the production of blood, and the fluid production and circulation systems within the body. If a piece of that fluid circulation system stops working, like the lungs and the kidneys stop communicating, then we get issues with circulation of fluids. One of the conditions that can arise from the lungs and the kidneys not communicating, excuse me, is a type of asthma. That asthma often arises in kids who are fearful and therefore get regular kidney damage when they're young. It's not well treated by Western medicine interventions. I had a patient when I was in my last year of acupuncture school, when I was working as an intern, who had this type of asthma. She was in her early 30s, very puffy, swollen, almost edematous, and almost had edema, almost like press on her. It's a little extra squishy, not in a way that indicates fat, but water retention. And after doing a long diagnostic investigation, put her on a formula that involved about 10 times the normal recommendation of the herb futsa, Aconita radix lateralis preparata, which you guys, for those of you who've already done intro to herbs, you've already learned. Within 1 week, she'd gone from using her rescue inhaler 5 times a day, which is bad within a Western medical way of thinking, to not needing it all. By week 2, she had stopped using her normal inhaler as well, which she had to use twice a day as well. And she'd lost 20 pounds and color had returned to her face and body. And we took her off the herbs, and she didn't, for the next 9 months that I knew her, she did not need to use anything for her asthma. 2 weeks, done. 20-year condition. And the only issue was that 2 organs weren't communicating. One of the things that makes figuring out balance difficult is that it's not static. So if the question is, for example, does a patient have depression or not within Western medicine, we don't care whether it's winter or summer. If it's winter, we might say, well, this looks like seasonal affective disorder. Or let's use low energy. A patient has low energy, and whether they have low energy in February or August isn't really important, except that in February, we might also recommend vitamin D. Within Chinese medicine, we think people should change. We think that you should be a decently different person depending on the season, depending on your age, depending on your constitution, and depending on your goals. We think that you should change all the time, so that the balance is less like building a house, which would be maybe more the Western medicine way of looking at it, and a little bit more like riding a bicycle, or maybe a downhill unicycle, where there's constant shifts and changes and where you're often out of balance, but that the entire whole becomes balanced. This static versus dynamic is going to be a concept that we keep returning to, with the Western medicine view looking more like we want to hold this in a way that doesn't change and stays this way, and Chinese medicine looking more like, well, if we just go back and forth, then the overall is going to be balanced and the person's going to be able to move with that more. Yeah, making sure that's not the next thing. I see this showing up if for funsies, anyone decides to study numerology, or anyone here has a background in numerology, one of the things you might know is that within, or is familiar with Chinese culture, you might know that the number 4 within Chinese culture is considered bad luck. If you give someone 4 of something, you're kind of saying like, I want you to die. The word for 4 is si, which is a homonym for death. So 4 is considered bad. Part of the reason 4 is considered bad is because something that's balanced on 4 pieces doesn't move, it's static. And things that don't move are considered to be dead within Chinese philosophy, not just medicine. Within Western numerology, within the way that all of that developed within the West, 4 is considered to be stable and safe. The static, the unmoving, the castle is considered to be a place where there aren't problems because nothing changes. Change is considered frightening traditionally and dangerous within Western thought. Within Eastern thought, it's considered mandatory. Though there's a negative version of change within the Eastern thought as well. So we want to balance the person on a whole bunch of factors simultaneously. So this creates a gray zone within Chinese medicine as well, though, because we're doing all of this subjective work because we're happy to work with the patient's subjectivity. That creates a world in which sometimes we as practitioners can't communicate perfectly well. So if you go to a Western medical practitioner, they get your labs done and they send you off to another doctor for a follow-up, like you start off your treatment here in New York, you move to California, you're seeing a new doctor, that doctor can request records from the old doctor, and they can be caught up to speed on what's happening with you very quickly and be able to continue the care with not a lot of break in that chain. This is made easier by the medicine being objective. Of course, there are plenty of edge cases there too where that doesn't work, but by and large, that's how it works. Within Chinese medicine, I can't necessarily refer my patients to someone else unless they've been trained by the same people that I was trained by, unless we've worked together for an extended period of time. So what I see as a balance issue within the person's body to someone else might be a major pathology. I might be focused on a person's sleep. Someone else might be focused on their constipation. There are different ways to start with these things. And when we're working with subjectivity, that also means that on the practitioner's side, there's some level of subjectivity, which is very challenging to work with within a Western medical model and can be quite annoying to work with within a Chinese medical model if you're sharing patients. It's one of the reasons that acupuncturists don't always play well together, but we'll leave that for later. So within Chinese medicine, we see the imbalances that get created within a person's system, creating the terrain in which pathology can take place. So if we don't resolve the imbalances, then the patient gets sick. If the patient doesn't deal with the pathogen once it's arrived, then it can accumulate and cause further damage within their system. It can grow, it can transform into other pathologies, and eventually can lead to the point where there's major problems. Ideally, we act at the level of imbalance, well before they have any pathology at all to deal with. This is what we mean when we say preventative medicine. We mean we want to go in when you're just a little qi deficient because you didn't eat well the past couple weeks because whatever happened, and strengthen your qi so that you then don't get sick. So within a Western medical way of thinking, this would be boosting a person's immune system as opposed to treating the disease. But the idea of boosting an immune system is very hard to wrap your head around, because what is a healthy immune system? What's an unhealthy one? We can look at something like AIDS as a very easy example of, oh, that's an immune system that isn't working well. But for someone who comes in who just seems a little, who in Chinese medicine we would say, oh, their wei qi is weak, their likelihood of getting sick is increased, we can work with that. Within Western medicine, it's a little bit harder to tell whether or not that person is in that state. Subclinical. This making sense? Everybody with me? Okay, good. We can, if anyone has questions, we're going to start moving on to other stuff here in just a minute. Does this difference between Chinese and Western medicine make some sense? Is this something people have had personal experiences with? I mean, the number of patients I've had who come in and they're coming in for their migraines and I ask what else is wrong and they say nothing. And then 10 minutes later, after I've gone through the body systems, we've got a list of 30 things that are bothering the patient, because this is often what brings people to Chinese medicine. Is this familiar to any of you? I'm seeing some nodding. That's nice. That's good. You know, these are the sorts of things that are a lot easier in a classroom setting, because I can look around, like an in-person classroom setting, because I can look around and be like, okay, that person's over there shaking their head and looks frustrated, but it's a little harder to tell online in this way of doing it. So
when I used to work at a oh, I'm sorry, are you talking? I have headphones in, so I can't tell somebody I'm talking over someone. But when I used to work at an acupuncture office and people would come in and they would be like, oh, like the office that I worked at was more of like a mainstream. So it was like kind of advertised more as like a spa-like thing. We had people who would come in for serious issues, obviously, But we would also have people who would just come off the street and say like, okay, I'm just interested. What is this? So a lot of the time what they told us to tell them, not the acupuncturists themselves, but like the managers of the clinic, is to do like oh, you can come in for like a general like wellness thing of like, you want energy, like sort of like a lunchtime thing of like, okay, you want energy or something like that. But I guess I just was always curious because obviously that's a manager saying it. When they go in with an acupuncturist, they're not going to be like, okay, we're just going to give you the general wellness treatment. Like, it's not going to be like that. But I'm just assuming when you were saying like pulses, you could sort of like see like, okay, wait, maybe there is something with an issue with their stomach from their pulse, or like you see on their tongue that there's something going on with like the heart. And then you sort of like gauge that way of like asking them more specific questions, I guess.
Yeah.
Of like,
Yeah,
okay, can you not sleep during the night? Like, sort of gauge more of it.
Yeah, I mean, so so in my clinical practice, what I often do is people come in, they've got some thing that they want to work with, or else why are they coming in? And once that's resolved, then we figure out like, okay, what does a maintenance schedule look like for you? Oftentimes that's quarterly and then as needed. It's like, look, just come in, quarterly. If you're really stressed out, come in, we'll help you out with that. But otherwise you come in and we'll just go through all of the systems, figure out if there's anything minor that's begun to show up, and hopefully knock that out before it becomes any sort of an issue. And if you happen to get sick, then come in then as well, and we'll work with that. The tongue and pulse are really useful. A lot of people give up on pulse, and quick aside before we move into the next thing, a lot of people give up on pulses because they seem hard. Just take as many as you can. You'll start learning stuff. It takes a few thousand before, at least in my case, I started to really be able to get much out of them. But you look at a person's tongue, it's like, okay, this person has a really red tongue tip, and they're coming in for chronic urinary tract infections. I'm not going to explain how that works in detail right now. We'll actually talk about it later this semester, though. So it's like, okay, I want to see how else this heart fire is manifesting. Are you feeling anxious? Are you having nightmares? And kind of go down this line, and then that tells us how this is propagating through their system, how to work with it.
Okay. Thank you.
Yeah, you're welcome. As with pretty much every profession, the marketing and the reality are somewhat different. So the
Exactly.
Come in for an afternoon tune-up is like, yeah, that's like a great way to make money, but everything, like there's an acupuncturist in New Jersey who's an ophthalmologist. He's one of the best people in the English-speaking world using Chinese medicine to treat vision problems. He sees people fly out from all over the world. He's got a map of the world in his waiting room with pins all over it. And he usually sees people for 1 week, 2 or 3 times a day. Very intensive treatment, lots of herbs. People are flying out. That's how you do it. And he has people doing eye exams each day to see how they're progressing. And he gets good results fairly quickly with that. I've completely lost my train. Why was I talking about that? That person has the exact same title as someone who does stress relief acupuncture in Brooklyn. Like, they're technically in the same profession, despite this person being an ophthalmology expert. It's the same thing. So when we say like, what do acupuncturists do? It's like, I don't know. It depends on the person. An acupuncturist who works at Spa Castle is not doing the same thing as someone who works at Sloan Kettering. But it's the same title. So, yeah.
I have a question about
Sure.
the point of like the imbalance, like, and that the pathogen, or it says that we're always, sorry, I was reading that.
Sorry.
Just like the idea, like that we may always be changing an imbalance, and that like maybe should people get acupuncture like more regularly, just to maintain, and prevent.
I mean, that's, I'm biased because I'm an acupuncturist, but yeah, in a theoretical world, I would like to see most people seeing a well-trained acupuncturist as a checkup regularly. Selling people on that is a challenging idea because it looks like you're just selling people on something that makes you money. But clinically, I've seen that. I've had patients who come in who are like, you know, I've got this minor thing. It's like, okay, we take care of that. It's gone. And then it's never heard from again. And heartburn's a good example. People are like, you know, I think I've been getting heartburn. It's been getting worse and worse for the past 6 months. They're coming in for, you know, low back pain. Like, oh, this heartburn's getting worse. It's like, okay, well, you know, we're going to treat your low back pain, and here's some herbs and a couple needles, and then you never have heartburn again. Like, often that heartburn is step 1 of 7 steps that end up with them getting endoscopies and getting treated for GERD and changing their diet. So we're, you know, often we can just catch these things early, nip them in the bud. It's very hard, and playing devil's advocate here, it's very hard to tell whether you prevented a disease or not. You don't get to know. You know, most people spontaneously recover from most things. So if a patient comes in for heartburn and you treat them, you know, I've had patients who, you know, they come in for an ankle injury and they also have heartburn. In my head, I'm like, okay, we'll treat the ankle injury. And, you know, if they come back next week, we'll treat the heartburn. And I only see them once and they say like, oh, my ankle's doing great. And then I run into them 2 months later and they're like, you know, you fixed my heartburn. And in my head, I'm like, and I'll say to them like, oh, I'm glad you're doing better. That's great. And in my head, I'm like, I never treated this person's heartburn. Their heartburn just got better. It can be challenging to know what we do for some of these when it comes to the preventative side and what we didn't. People who get acupuncture seem to get a lot less sick and have less problems. So yeah. Yeah, Kendrick, great point. So this is Kendrick in the chat. Definitely experienced what you're talking about. Had an OBGYN who wanted to treat PMS symptoms by giving me an antidepressant for just the week of my period. Yeah, that seems like a bad idea. So I started seeing my acupuncturist and I felt so much better. Yeah, I mean, I think the basic bar for competency in acupuncture is you should be able to almost completely resolve most women's menstrual issues. That's a sign that you're beginning to get Chinese medicine. And within Western medicine, there's just not a lot on offer there. So, Kendrick, I'm glad that you decided to go that route as opposed to antidepressants. Okay, let's see here. I'm gonna stop sharing this and just take a look at this screen for 1 second. If anyone else has questions, feel free to ask them. I'm just checking our timing. Oh yeah, this is fine, this is fine. Okay.
I actually have a question. It's kind of a question and statement together.
Sure.
So it's kind of going along with what everyone was saying earlier. Mine is more about, and maybe we'll address it later in the lecture or later in the semester, about actually getting people to understand what acupuncture can do. I think in the last semester, I asked the professor about, it was actually clinical counseling. I asked Dr. Yang about like things, you know, like YouTube videos and stuff like that and social media, where they talk about acupuncture as like, oh, this crazy thing that I'm trying, you know, so that they get views. And a lot of people treat acupuncture as almost like a facial or, you know what I mean, something like a massage, like a Swedish massage or something along those lines. And they don't actually understand what they can go to an acupuncturist for. And my question is kind of, how do you, even to, let's say, patients that you see, how do you kind of get that across that acupuncture is actually about overall health rather than just like some kind of like, you know, optional, you know, pleasure treatment that you get once in a while?
Sure. Good question. That's hopefully the lecture we've been doing so far today helps show why that's a challenging thing to do. Because some of this involves like, hey, you know, all those things that your doctor says are normal. How about we think differently about that? Now, on the one hand, that's a good sell. On the other hand, that's also what snake oil salesmen say. So it's hard to it can be challenging to figure out how to get people to rethink their approach to their own health without seeming like you're involving them in a multi-level marketing scheme. You know, just take this cleanse and you'll feel better. What I find is I work on the personal level. I work with individuals, so it's individualized. Chinese medicine's individualized, so the way I talk about it tends to be too. So if a patient, if I'm at a dinner party and someone's like, so what do you do? And I mention acupuncture and they go, acupuncture, eh? I've heard about that voodoo. Then, you know, I'm going to be flippant and casual about it, and that's fine. But very often people are, God, I just haven't slept on it. It's like, if you want to come in, we can probably sort that out for you. And other ones, they come in, I mean, I half jokingly say it all the time. You know, patients come in for their low back pain and they stay for their childhood trauma, insomnia, and indigestion. Like, that's pretty common. The general public is becoming more aware that we're good at treating pain, and they're becoming less interested in the Western medicine answers. Once people experience good acupuncture, they tend to be very open to other ways of thinking about it. One of the things that we do, we're going to talk about this way later in the semester, is that when good acupuncture brings a person's Shen back, it helps reestablish their Shen within their heart. And people feel, the number of patients who say, you know, after that acupuncture session last week, I just felt more like myself than I have in years. It's like, that's usually all the sale we really need. It's like, yeah, your back pain's somewhat better, but you also just feel more alive and more you. I think one of the main things we can do at this point is get more involved with organizations that give us more credibility. More and more acupuncturists are working with the VA. The VA is not known for investing large amounts of money and time into things that don't work well. I mean, they are, but not practitioners. That answer your question a bit? Cool. Okay, we just got 2 more slides. Oh, yeah.
I'm going to say something. I had a moment of an aha the other day. I was talking to my boyfriend about, I have this thumb issue that I feel it has translated from my elbow and my shoulder injury from swimming. So I'm feeling like I'm not, my stroke is, something's happening with the shoulder. And my boyfriend asked me this question. He said, so, because I was talking about going to the my friend who's the chiropractor. And he goes, so would you go to the chiropractor or Bridget, our friend who's the acupuncturist, for that? And he was like, why? And would you? And like the choices that we make, or that I was going to make for this issue. And I sat and I was like, oh, it's funny. I'm in school for this modality. And I didn't think that I would go to the acupuncturist for this, something that I feel is structural. But it was such a pause, a moment of like, okay, well, if I went to Bridget, my acupuncturist, what would she do for this thing that I'm considering structural? But then I also feel it's nervy. So it was just a nice moment to self-analyze, question the thing, you know, these different modalities.
Absolutely. And this is one of those things of like, if a friend of mine, let's say I have a friend in Washington State, so they're not coming to see me, and they present this exact case to me in a phone call. It's like, you know, having the thumb issue, should I see an acupuncturist? In my head, I go, you should see a good acupuncturist who does orthopedics. But that's not necessarily something that a random acupuncturist is going to do well, because we have the same title, whether you're doing facial acupuncture or spa acupuncture or orthopedics or internal medicine, the same title. So as someone who does a lot of orthopedics, it's like, yeah, we're great at that. And chiropractors can be good. There's more and more chiropractors who have dual degrees. There's a whole Chinese system of bone setting that gets used quite a bit here in New York because the people who teach it are out of New York. Yeah, cool. I'd consider looking into the meridian that goes to your thumb and where it starts in the chest, and looking at the muscle meridian, you might find that your pain is tracing it very closely. And
yes, I was very sick with lung issues this January, February, and I have large intestine issues. So when you think about, they're all going out towards the thumb.
Mm-hmm. Yep. There you go. So that would often be how the Chinese medicine person would be looking at it, is like, I don't really care about your thumb pain. I care about your metal issue. And if we resolve that, then that will like untwist this thing. And as it unspools within your body, the issue in your arm will resolve itself. That'd be a deeper level way of thinking about it. And Carlin, 100%. Tui Na is very important. Tui Na, the Zhenggu Tui Na, for people who like to be hands-on, the Zhenggu Tui Na people in New York, they do, I think, a 1.5-year long program, 2-year program that you don't get any license, anything from it, but they give you a certificate, and they are rigorous and they are good, and they teach you bone setting in the 2nd year. Tom Bizzio and Frank Butler, they are one of a couple groups that have written the books on orthopedics in the West. But yeah, Carlin, learn how to put your hands on your patients. It's important in a therapeutic way. All right, we just got 2 more slides here and we're going to take a break. So the next thing we're going into is we're going to start talking about pathology. So what is, so we're not talking about imbalance next. The excess and deficiency will be a little bit of imbalance, but we're going to start talking about what does pathology look like. That's what comes next. And this is the thing I want you to put in your head and take away from this lecture. This is like, if I can summarize the past hour in a sentence, within Chinese medicine, lack of disease does not mean we have health. Lack of disease and health are not the same thing. We have something that we want to avoid, which is disease, and then we have something we want to gain, which is health. And generally speaking, within the Western medicine way of looking at this, if you don't have disease, then you have health by definition. So we have a whole different definitional structure for this. All right, let's take a break. You guys got 10 minutes, come back at 10:15. I got a couple things to do, but I'll be back a little bit early. I'll be back at 10:10 and happy to chat with people, take questions. Sound good? Great. See you guys in 10 minutes. All right, I'm back. If anyone has any questions they want to ask about. Jennifer, I see your question. I'll get to that in just one sec. Okay, everyone, welcome back. Just grab a little water and I'll be ready to go. So we're going to be diving into the second PDF I posted at the beginning. I'll put it up here again for anyone who missed it. Is Slack working for everybody? If anyone's having any issues, let me know. It's I usually find it's a little challenging to get a lot of engagement in the first, this stage of people's education, but the herbs class I have on there, I think we have 10 pages of back and forth content at this point. So feel free to hop on and ask questions in between classes there. Let me put this on. So we're going to be going into this PDF next. Causes of disease 1, part 2. Yeah. All right. Throughout the semester, I'll try to keep posting resources like this Junggu Toina textbook and some of the information about them. They're not offering classes right now. Nobody's offering classes. No one's offering continuing education stuff in person these days, for good reason. Yeah, if you have questions about specific specialties, let me know and I'll try to point you in the direction of somebody who specializes in that as well. Or books they've written. Okay, causes of disease 1, part 2. So, this is an older version. I'm not sure what the newer one is. So this is slightly different than what we're actually going to do. We're going to be going over stuff on the internal and external pathogens are going to be before the midterm, and then Zongfu is going to be most of after the midterm, and then we'll see what else we can get to after the midterm. Instead of, I need to make a note to edit this. As opposed to trying to cover all of this in one semester, I realized that after the second semester of teaching this, that it makes more sense to go a little more in depth into some of the categories than to try to cover this much.
What is it?
Way too loud. Take it off of the headphones.
If I don't write this stuff down, I'm never going to update these. Okay, let me just mute Melissa here. All right, let's go. So we have different pathogen models that we use within Chinese medicine, though we're mostly going to be talking about the Zongfu pathogen model, the internal and external pathogen model, and substance pathology models. Every different pathogen model can be specialized in. So there are people who are experts in Shanghanlun. There's experts in infectious disease, which would be internal pathology. There's people who are specialized in 5-element approaches to Chinese medicine. So each of these are things that you can focus on. This becomes doubly true in herbology. I would say broadly speaking, acupuncture has more room for improvisation and jazz and adaptability when you're working with patients. And when it comes to herbology, you have to get things right in the beginning. So if acupuncture is wok frying dinner, herbology is baking. You better get it right at the beginning. So it's a little more specific and then more narrow specialties often. So we're mostly going to be talking about Zongfu, internal external pathogens, and substance pathology. So let's go over what those look like. So you guys know the phrase, the words Zong and Fu. So that's just a fancy way of saying organ pathologies. Zong organs are going to be the yin organs. Fu organs are going to be the yang organs. It's often translated as solid and hollow organs. So the organs that retain and hold, and the organs that pass through. So the intestines are hollow, the heart is going to be solid. It's not based upon the Western anatomical understanding every time. In general, the yang organs are going to have an entrance and an exit, and the yin organs are going to have one entrance exit. So the lungs, for example, the entrance and exit is in the same place. Intestines enter and exit. The internal and external pathogens, we're going to spend a couple of weeks on those coming up. And substance pathology, so that's things like qi stagnation, blood stagnation. We'll get to that as well. To begin talking about this stuff, we need a little bit of terminology. So very often Zongfu and substance pathology gets mixed together. And it usually looks like this. Location followed by type of problem. So heart, that's the Zongfu part. Blood, that's the substance. Deficiency, that's the pathology. This could be liver, qi, stagnation. That's still going to be location, qi stagnation. We also have the Zongfu with internal or external pathogens. So substance pathology, it's blood deficiency. Internal, external pathogens, that's fire, heart fire. We're going to spend a lot of time on this. I'm just introducing the words. So very often, what happens when you're learning these things is that you learn how to treat heart fire, you learn how to treat heart blood deficiency, you learn how to treat all of these discrete diagnoses. It's like, oh, well, if heart fire, then these points and this herbal formula. This is often called cookbook acupuncture. You know, you've got the thing you want to make, the thing you want to work with. Okay, do this. I'm not a big fan of cookbook acupuncture, but you do have to learn it to be able to understand other things. Some people are great at it, it's not my jam. So I'm going to be teaching you guys a little bit of a deeper way to think about it, but if you end up wanting to just do cookbook acupuncture, that's great too. A lot of people will get a lot of benefit from it. So this is what diagnoses look like within most of what you're going to learn at school until you're in the clinic and working with supervisors. But I don't think that's really the reality. This is what diagnosis looks like when I see patients. So patient comes in, chief complaint, discomfort in the ribs, and they end up with a diagnosis like liver stagnation with underlying spleen qi deficiency due to poor postnatal qi production, due to lung qi deficiency, due to lung yin damage from heat accumulation from smoking, due to metal phase issues, due to unprocessed grief, due to earth damage, due to disconnection from parents in early life. They come in and they say, I've got discomfort in my ribs. Liver qi stagnation, the main sign of it is rib side pain. That's what the textbooks are going to say. So it means hypochondriac pain, not hypochondriac like imagining you're sick, but hypochondriac like below the chondra, the ribs. And they're coming in for discomfort in the ribs. And once we start talking, they also have emotional volatility. They have difficulty connecting with others. They can't cry. They're incapable of crying, but they do get angry. They've got a cigarette addiction at 4 a.m. You guys remember your body clock. They wake up and they eat ice cream. They have low energy, depression, anxiety, insecurity, and low back pain. They're here because their ribs hurt. But once we start talking, all of this other stuff is here. And as we go through all of that, their response is, but that's normal. We're not going to be doing any diagnosis that looks anything like this until you guys are in the clinic. For now, we're just going to be sticking to things like this. So disease categories. This is often an area of confusion for students. We've got types of disease like asthma or diabetes, which in Mandarin we call xiaoke, wasting and thirsting disorder. Same concept. That's what it comes from traditionally. We got 2,200 years of discussion of diabetes. These disease categories can be a big point of confusion for students. Often these have a Western medical name, like asthma, but they're not really the same thing. So when we say asthma or diabetes, in Chinese medicine as disease categories, it's going to be useful on your end to think of this more like renal disease within Western medicine. It tells us where the problem is. Like, so if the patient has asthma, we know that they're going to have some level of wheezing. We know that there's respiratory issues, but we can't treat asthma. We have to figure out what type of asthma it is within Chinese medicine. Same with diabetes. We need to figure out what type of diabetes it is within Chinese medicine. What we're talking about here, this is a preview for later, like year 2, but I want to make sure that this idea is in your head before we start talking about diagnosis. Yeah, so an example of this would be coughing. So when you cough within Chinese medicine, that's lung qi moving in the wrong direction, period. That's the whole story. With stomach qi, that's burping or vomiting. With spleen qi, that's diarrhea. And those are the main things we talk about in terms of counterflow. We talk about other things, but those are the main things. But when we say that the person is coughing and that that's lung-qi counterflow, we have many reasons why they might be coughing. If the patient coughs when they get emotional or when they get angry, we might be looking at how the liver is interacting with the lungs. If they get a cough at night, we might be thinking about this being yin deficiency within the lungs. Don't worry about the exact diagnoses here. We'll get to those later. The point here is that there's many different reasons why they might be manifesting these symptoms. And if we don't know the reason, we really can't treat these things. Diabetes as well. We see diabetes as a symptom. Now you could say within Western medicine, sure, diabetes is a symptom of the breakdown of the B cells within the islets of Langerhans within the pancreas, or it's a problem with insulin uptake within the cells, but that's not how we're thinking within Chinese medicine. While diabetes is a diagnosis, until we know which type of diabetes they have, we can't treat it. And this is not type 1, type 2 diabetes within Western medicine. This is just talking about type 2 diabetes. So 3 main signs of diabetes within a Western medical context, same as ours. Gnawing hunger, persistent hunger that doesn't go away even after eating. Persistent thirst, patient's always thirsty and often urinating clear, so drinks tons of water, urinates clear, and just always feels dehydrated and thirsty. And the last one is wasting away. We've largely gotten rid of the wasting because insulin injections are going to prevent that. But if you have someone with unregulated diabetes, they hit a point where they start just shedding weight very rapidly. And you can have 1, 2, or 3 of these symptoms, though generally you don't get the wasting away without either the thirst or the hunger. That's all Western medicine. Within Chinese medicine, gnawing hunger tells us that the patient has stomach yin deficiency. If they have that, then we're thinking stomach yin deficiency. This is often true for patients who have gnawing hunger who don't also have diabetes. They often have stomach yin deficiency as well. If we see gnawing hunger in a patient without diabetes, then we want to treat that early because we see that as step 1 of, say, 7 steps that leads to them being diagnosed with diabetes. The patient's yin being weak within the stomach, being deficient within the stomach, leads to a desire for more food and an attempt to rebuild that damaged yin. And that often also causes heartburn, which is very common in diabetics as well. The persistent thirst is a symptom of lung yin deficiency as opposed to stomach yin deficiency. Instead of trying to bring food in to build up the stomach yin, we're trying to bring in fluids to build up the lung yin. That damaged yin has caused the lungs to dry out somewhat. And often we also see problems with the skin if it's a lung yin deficiency issue, something very common in diabetics, usually on the hands and feet, often the feet, small sores showing up, things not healing well. That's a sign that we're looking at the lung side of things. And for wasting, we're looking at kidney yin. That also comes with serious fatigue, comes with depression, often comes with a lack of direction within life, all of which are things that we associate with the diagnosis of a terminal disorder like diabetes or semi-terminal. Within Chinese medicine, we see that as actually a product of the organs and the systems affected. So while on the one hand, lung, stomach, and kidney yin deficiency are all diagnoses, they're usually not the diagnosis we're looking for. It's kind of similar to in Western medicine, you can diagnose someone with proteinuria, protein in the urine. Without knowing why they have the protein in the urine, aside from maybe some kidney damage, we can't do much to treat this yet. Same with neuralgia. Patient has nerve issues in their fingers, let's say. They're having nervy sensations, reduced feeling. That doesn't tell us much yet. We need to figure out why they have that to be able to do anything about that. So when it comes to lung, stomach, kidney yin deficiency, without knowing how they began developing these issues, we're limited on what we can do. So there are a lot of different pathologies that can cause the damage to the substance. The yin is natural. We want the yin to be there. We want the physical substance of these organs to be healthy. If the patient has an external disease invasion, something as simple as a common cold that goes untreated and develops and evolves within their system, or emotional things that have grown up inside of them, or miscellaneous disorders like accidents or injuries, over time, this can damage the yin and create the problem that eventually gets diagnosed as diabetes. We call this way of looking at things root and branch diagnosis, which is to say, the root is where the disease comes from, and the branch is the manifestation of the disease. So the patient's long-term consumption of hot, spicy, and sweet food that ends up damaging the stomach yin would be the root, and the diabetes would be the branch. Unless we begin addressing the root, we often don't expect the branch to get better. So when it comes to lung, cough, or asthma, maybe the disease category. Lung qi counterflow, the lung moving the wrong way, is the branch. That's what we see. That's the problem that manifests. Yes, their lung qi is moving incorrectly. That is the cough or asthma. And then underneath that, the root is going to be the liver insulting the lung from your 5-element diagrams. So until we address this, we can't address the lung qi counterflow. Again, don't worry about the specifics of this diagnosis, just introducing you to these ideas so that we can go into the types of disease and get deeper into this. We're going to be layering throughout this semester. You may have already heard the phrase, "it depends," in response to questions you ask from professors fairly regularly. If you haven't gotten sick of hearing "it depends" yet, you will by the time you're done with school. But what "it depends" usually means is the question that you're asking is incorrect or an unanswerable question. So something you often hear, and one second. It's very hard for me to figure out your names when looking at this. This goes to the point made by Carlin earlier. It's often challenging for us to communicate with patients at the level of how we think, as opposed to the level of how they hear, because patients will ask things like, what points are good for diabetes? And within Chinese medicine, that's not something we can answer. That's not a question that we work with because we don't have points for diabetes. We don't, in fact, on a certain level, we don't treat diabetes. But we do look at the root. We look at the problem underlying the diabetes and work with that. So this would be similar to saying within Western medicine, like, so what drug do you give for an infection? Like, well, we've got this class of drugs we'd consider. What's the infection from? But there's many types of infection. Unless I get more specific answers, I can't tell you what to do about it. That makes sense? You guys with me here? Okay, good. So when you hear "it depends" as an answer to your question, the answer is usually, well, it's really complicated, or that level of question is not something that can be answered. I'm hopefully going to also try to tell you why it can't be answered. But the reality is that it does depend. It depends is true. Oftentimes we have one root, like liver insulting the lung, that could cause asthma, but it can result in many different branches. I mean, it can result in branches as liver insulting the lung can result in lung problems. It can also result in problems within the lung channel. It can result in thumb problems. So we need to know how the problem manifests, and then we need to know where the problem comes from before we can really begin to treat these sorts of issues. We're going to be going into this a lot more later on in the semester, and then you've got a bunch of semesters to learn all of the specifics for all of the different things that can go wrong within the body. Is that it for this slide deck? Yeah. Okay, that makes sense as an idea. There's a little intro there. Good. There's no questions. Any questions? Not so much. Okay, we're going to go into the third one here. I'm just putting these back in chat again in case anyone missed them earlier. All right. So that's a little introduction to how we think about disease. We need to know not just the diagnosis, we need to know why the diagnosis arose in the first place. And then we often treat the reason it arose. We'll go into more detail on root and branch diagnosis in a few more weeks. Again, this is just a first pass on these concepts. And on certain levels, we're still in the introductory section of this semester. So here we're going to be going into a couple of the things here. Start with body as a city. So somewhere, ballpark, there's argument about it, somewhere around 2,500 years ago, we have the Huangdi Neijing. This is the first written complete text that we have on Chinese medicine. And this is where we get most of our original thinking from. This way of thinking of the body as a walled city, or as a city in general, can be helpful for thinking about how things work within Chinese medicine. I regularly use these metaphors with my patients. They seem to appreciate it. Depends on the patient. You talk to different people differently. And the idea here is that each organ within the body can be talked about as if it's a profession within the government. I need you to memorize this. I need you to memorize this in part because I think it's important, and in part because you're going to be tested on this for your comprehensive and board exams. So you need to know all 12 organs and their associated role. That might be a hint for things that you will see on quizzes and the midterm and the final. So the court is made up of the heart being the emperor. Emperor, and of course, when we translate these, once again, this isn't emperor in like a King Arthur sort of a way. This is emperor within the Chinese cultural sort of a way. The job of the emperor is to perform the rituals that keep everything working. It's not really the emperor's job to give edicts for what should be done with grain shipments, what should be done to organize a city. It's the emperor's job to communicate with heaven. Heaven, not in a Western Judeo-Christian sense, but heaven within a Chinese cultural sense. It's the emperor's job to communicate with heaven, make sure the rituals go properly, and make sure that the Tao is being followed. It's the lung's job to make sure that all the I's are dotted and all the T's are crossed, which I guess the Mandarin version would be make sure all the strokes and the characters are in the right order. So while the heart rules the body, it does it in a pseudo-spiritual, religious sort of a way. And the lung instead is the one that does most of the day-to-day regulation. The lung is the prime minister. The liver functions as the general of the army. So when we go to war, it's the energy of the liver that we use to go to war. When you get in a fight with someone, when you argue with them, we're looking at the liver. When someone doesn't fight, when someone doesn't get angry, when someone always rolls over and gives up, we look at the liver. Is the general too strong? Is the general too weak? The pericardium functions as the envoy or the ambassador of the heart. We're going to spend about an hour on every single one of these organs after the midterm. The pericardium is often how we present ourselves to other people. Very frequently, social things, we're going to be looking at the pericardium for how the person is an envoy for themselves to their community. The kidney is the minister in charge of health. How healthy is the person? Like, shipments can be getting around, the prime minister can be doing their job well, but the foundations of the city can be rotting underneath them. That's the kidney. The kidney's in charge of making sure that's still working. The spleen and stomach hold all of are in charge of the granaries, where are our day-to-day resources, the things that feed everything and keep them going. The gallbladder functions as the spy. It's often called the official in charge of discernment, which is an okay translation. I like secret spy of the heart better. We'll talk about that quite a bit when we get to the gallbladder in week 9 or so. The gallbladder is where things like intuition are, a sense of right and wrong, a knowledge of what we should do in any situation. When someone's lost and doesn't know what to do and can't make anything of the world around them, it's the gallbladder that gives them a little like, hey, maybe you should do this. It's the voices in our head in a non-schizophrenic sort of way. The large intestine is the official in charge of transportation. and conveyance, technically, transportation and conveyance. We'll go further into these when we talk about each organ. Are things moving where they need to? Is waste management happening? You know, the large intestine in many ways is the trash collector of the body. Make sure that things get out of the body. The small intestine is the official in charge of receiving. Sometimes it's called the official in charge of receiving plenty, but its main job is to separate out what we want to keep from what we want to get rid of. So you could think of them as accounts receivable. And the Sanjiao is in charge of irrigation and waterways. So all of the fluid regulation through the body, it happens through the Sanjiao. The Sanjiao doesn't actually do the fluid movement. It just makes sure that the pipes are in the right places and that they're all able to function well. And the urinary bladder is in charge of outlying districts. So all of this is the walled city, and then the urinary bladder is all of the outlying pieces of the body around it. So the urinary bladder, to a certain degree, integrates everything. Which is one of those things of like, well, we're definitely not talking about the same urinary bladder that we're talking about within Western medicine. Urinary bladder within Western anatomy and physiology does not perform a whole lot of systemic regulatory functions. Within Chinese medicine, it's a very important organ, in part because we're only partially talking about the organ. We're largely talking about the channel. So when we say things like the urinary bladder has an important role in directing energy to all of the other organs, we're not talking about the sac that holds urine. We're talking about a different aspect of this. It's a translation issue more than anything else. So each official becomes its office, and it also becomes whatever that office governs, roughly. Every organ is going to have qi, blood, yin and yang, as we talked about last week, and as you learned in FCM 1. The qi of each organ, to a certain degree, reflects the organ's employees. The blood, their resources. The yang is their motivation or morale, and the yin is their infrastructure. Which is to say, so let's take the general as an example. So talking about the liver qi are the soldiers in the army. The liver blood are the army's provisions. It's their food, it's their weaponry. The liver yang is their morale. The liver yang gets out of hand, then you've got a bunch of berserkers rampaging around, and you've got a person with anger issues who's always yelling at people. If the liver yang is weak or depressed, then you've got an army that'll never go to war for anything. The person could have plenty of qi, they could have their soldiers could be well armed, but they just can't get up and do anything. And the liver yin is their equipment, and by equipment in this case we mean the carts that transport them, it means the roads they travel on, it means their clothes, all of those sorts of things. Again, obviously this is not literally what's happening in the body. This metaphorical way of thinking about these things can be useful. So when a patient comes in and they say, you know, after eating, I get bloated and distended and angry, we might ask, why is it that after the person brings in food and refills the granaries, the general plunders the granaries and goes to war immediately? Yeah. So a little bit further on the general, since it's the easiest of these to think about. Patient comes in, I get in fights with my friends and family too easily. I can get more of like the alcoholic chef archetype. I had a great line from one of them a while ago. Like, do you have a lot of problems in your life? The response of, I don't have problems, I make problems. Okay, well, we might be working with some anger here and with the general. Do they get in fights with their partner and friends too rarely? More of a doormat type. Then we're doing completely different things with their liver. But either way, we know where we're looking, and then we begin to investigate their pulse and their tongue and ask questions about how it relates to other things to narrow down exactly what it is that's going on, and then we can treat that with acupuncture nerves. This is an image of a traditional conception of the body. Head up here, eyes facing forward, heart void in the center. I wouldn't go too deep into looking at this exact one, But these drawings were taken seriously. This was not an artist's metaphorical representation. There are many different versions of these from different periods of Chinese medical history. These are attempting to convey to students, to people who are learning, what it is that's happening within the body. It's not abstract metaphor, it's as close as they can get to a graphical representation of the interactions and how things work. This particular one I find kind of pretty. We've got the spine coming along the back here. We've got the Ming Men down in the kidneys. We've got the soldier here for the liver, reaching upwards to heaven. These different ideas get repeated in these images. Within Western medicine, often when you see these sorts of drawings done for the body as an attempt to describe the internal structure, it's pure metaphor. It's often somewhat fantastical, and it's usually not done by serious medical professionals. Within Chinese medicine, there's a long history of attempting to describe things graphically and through metaphor, not just in Chinese medicine, but in many different branches of the culture. So all of this is to say that this model can be a full lens for diagnosis and treatment. I know people who this is the main thing, and we're covering it at this level, and there's a lot of depth to go into with this. But I know people who think about this every time they see patients. The more that you study and meditate on the literature, the more you understand how Chinese cities were operating at the time when these ideas were developed, the more this becomes useful. I don't use this idea that much, because this isn't something I've studied. It's not the thing that resonated with me as a way to interact with patients and to think about disease. I use it at a basic level, about the level I'm teaching you, a little bit further. And at a low resolution, it has a lot of value. And you also have to learn it because of boards and comprehensive exams. But this is one of the benefits of Chinese medicine, that we have all of these different metaphors that allow for people with different types of brains, different constitutions, different ways of thinking about the world to interact with Chinese medicine in different ways. One of the issues we have within Western medicine is if your brain doesn't work in the way that you are going to be taught the medicine, then you cannot practice the medicine. Within Chinese medicine, we certainly have things that you have to be able to do, but we have relatively artistic and metaphorical ways of practicing the medicine, and we have relatively anatomically driven ways of practicing, relatively scientific and anatomical ways of practicing the medicine. It creates a broader tent in which more different types of people can work. Is this making sense? People with me? Great, thank you. I appreciate the nodding or head shaking. So this is, we like personification within Chinese medicine. The idea, I'm fairly certain that I would have I've had MDs in my classes, but if talking to a large group of MDs, I think convincing them that the idea of using personification as a diagnostic and treatment tool, or anthropomorphizing parts of the body, trying to convince them that's a good thing would be a little bit challenging, as it is quite unscientific within that model. But we like this within Chinese medicine. Talking about organs as having a will, as having a spirit, as having a personality is useful for us. But the important thing is that we're not talking about them as if they have free will. It's like they're deterministic. It's like we have all of these archetypes within us. We have these somewhat predictable things. The liver's the general of the army. It's going to behave like an archetypal army general. It's not going to behave like the envoy the ambassador. Because these are mechanistic and predictable, then we can see how they interact, and we can create stories in ways that we can communicate to other acupuncturists and that are repeatable and teachable, which is one of the keys of a lot of Chinese medicine, that while it may not be scientific all of the time in the same way that Western medicine is, it is repeatable and teachable, which makes it scientific enough in a lot of ways. So when you see a patient, every person has a prime minister. They have their prime minister interiorly in the lungs. If we look at the person, if we look at how their life is organized, how good of a job is their prime minister doing? How good of a job is their minister in charge of the granaries doing? Do they save an extra 50 pounds of grain for the winter that they never use? Are they constantly storing for a rainy day and gaining weight? Or are they regulating their granaries in a way that seems appropriate for their needs? A person who's consistently gaining weight, we may ask the question, why is it that that the governmental structure, that the archetypes that make up their body believe that they need to be consistently preparing for problems that aren't arising? So if the prime minister's not doing a great job, what would a good prime minister be doing in the situations that they're in? And then how can we use qi, blood, yin yang, and fluids of the lung to help adjust the prime minister? Are they poorly organized within their system because they're qi deficient? The prime minister, who should be the organizing force, doesn't have the energy to get out of bed in the morning. Are they coming to you because they're anhedonic and depressed because they don't know what the point of life is? This sounds like a job for the emperor. What's going on with their heart? Qi, blood, yin, yang, fluids. What can we do? Do we need to direct resources from the granary to the emperor because the emperor has been starved? For some of you, these are going to be odd metaphorical archetypes that don't make a whole lot of sense and don't really seem like something you're really going to work with. Some of you might be having a like, oh, this makes so much sense moment. And this is one of the nice things about Chinese medicine. We have different ways of describing these things for different people. We're going to go just a little further with this. So one more time through the general. Your patient comes in because, this is actually based on a real patient I had. Patient reports unprocessed violent trauma from their past. I had a patient when I was I try to largely use patients that I had while I was a student, since the complexity level is going to stay within what within what you're going to encounter as a student. I had a patient who came in with the chief complaint of rage attacks. They associated this with abuse they suffered as a child. They were seeing a psychotherapist, but they felt like the anger was in their body and they had to get it out in different ways, and they found acupuncture to be helpful for this. Well, this deep anger that came from violent trauma from their past resulted in a dysregulated general within their system. If we're talking Zhang Fu diagnosis, we're either talking about an excess or a deficiency in the liver. In this case, we're talking largely long-term heat and fire within the liver. But we can go from the general acting inappropriately, acting violently, to, okay, that's liver, check the tongue, the pulse, is this excess or deficient? And then we get to the point where we can treat someone with long-term aggression due to trauma in basically the same way we treat someone else who's coming in for hypochondriac pain. Both of these are symptoms of liver qi pathology or liver heat, but the fact that they're completely different roots doesn't mean that the fact that the liver has the same issue in each case and we're treating that issue the same way, and that their symptoms are different, doesn't really matter that much. So we've talked about each of the organs as having a role, but they also direct parts of the body, and the end of the walled city is the wall. So at the edge of your metaphorical city is your wall, which is your skin. And at the skin, we have our physical personal border control, which is the Wei Qi, which is managed by the prime minister. The liver, the general, is not in charge of guarding the borders. That job falls to the prime minister. And we have Wei Qi, which is usually translated as defensive Qi, that is on the exterior. This is one of these places where things start to mesh. The skin is the organ of the lungs. Metal is the phase that deals with boundaries. If you have a patient who has boundary issues, you're probably working with their metal. And the lungs govern Wei Qi. All of these things are together. And when we begin looking at the exterior of the person, that's what we're looking at. On a certain level, the lung and the large intestine are also organs that deal with exchange from the inside and outside. The breath coming in and out, the large intestine being an opening to the exterior, both of these are organs that have a connection to the idea of boundaries. The large intestine and lung both being places where exchange happens from the inside of us to the outside of us. In Western medicine, and to some degree in Eastern medicine, we see places like the stomach and the interior of the intestines being outside of the body almost working like a donut. Food passes through us, but the actual absorption, the place where things become us, happens within the intestines and within the lungs. So they're both boundaries on the inside and the outside. Okay. Let's just get a couple more slides. I'm going to give you guys another break here. So Wei Qi, this defensive Qi. The body is a walled city, outside, skin. Wei Qi is going to circulate around in the skin. It controls the opening and closing of the gates in the wall, which is to say, it controls the opening and closing of the pores and of sweating. And it's the job of the Wei Qi to keep evils, keep the 6 evils or external pathogens from entering the body. So an evil comes in from the outside and our Wei Qi goes to battle against that evil on the exterior. If we have sufficiently strong Wei Qi, we don't notice anything, nothing happens. If our Wei Qi and the pathogen are fairly evenly matched, then we will draw reserves from the outside to the skin. We might get some shivers, we might sweat a little bit. If you were to be checking the person's pulse, then the pulse would temporarily become floating. The pulse would feel like it's very superficial, like almost like it's resting above the skin. And if the pathogen is stronger than the Wei Qi is, you get sick. And the type of sick you get depends on what the pathogen is. Just to try to integrate this a little bit, this means that people who get colds all the time, there's something wrong with the boundaries of their body, and we're going to go look at the lung to figure out why that is. Because the Prime Minister should be keeping us from getting sick by making sure that the opening and closing of the borders is letting in and letting out that which is beneficial and preventing that which is pathological from coming inside. This is the summary of every external disease that we have. This one page covers everything that you can catch from the outside world within Chinese medicine. This is every virus you can pick up. This is pretty much every bacterial infection. COVID is kind of in here. There are a few special cases that are outside of the scope of really your entire education at Pacific College. But this basically makes up the entire language we're going to use to talk about every disease that you can catch this semester. We've got 6 evils, and I need you to know every word on this page. It's not exactly a long page. So we have 6 evils: heat, fire, we're just going to put those together, damp, dry, cold, summer heat, and wind. These line up with the 5 phases, the 5 elements. Summer heat goes with damp for earth. And there we go. So heat and fire associated with the fire phase. Dampness associated with the earth phase. Phase and elements are going to get used interchangeably here. So you hear 5 phases, you hear phase, just remember the same thing as element. Dampness gets associated with the earth, dryness with metal, cold with water, summer heat with earth again, and wind with wood. This should all be familiar from the homework that you turned into me already, right? On top of these, we have a couple modifiers. These modifiers don't occur by themselves, but you can add them on to other things. We can have phlegm, and we can have toxins or toxicity. Phlegm and toxicity don't happen by themselves. We're talking about external disease. We're going to use some of the same words for internal disease, but right now we're just talking about external. Phlegm and toxicity come in with other things. And that's it. That's all of our language for infectious disease. These evils combine to make compound pathogens. So you can have an invasion of wind. A person can have a wind invasion. They can have a wind heat invasion. They can have a wind damp heat invasion, and they can have a wind damp heat invasion with toxicity. So once we start combining these concepts, we very quickly get to the point where we have thousands of options for how these things can fit together. You can't have, just building a box here around all the things that can be external disease, you can't have contradictory traits. You can't have a wind damp dry invasion, because damp and dry are contradictory, and you can't have a wind, hot, cold invasion. And you can't have modifiers on their own. You can't have a toxicity invasion or a phlegm invasion. Can I go over the rest of that? Yeah, we'll just stop there for now. So these associate with the 5 phases. I mentioned this earlier, but here's the slide that has all this written down. Heat, damp, cold, summer heat, and dry, all of the ones that aren't wind, when they come by themselves, are fairly rare these days. And they're mostly due to being in environments that are uncomfortable. So you need to be in an exterior environment that's difficult to stay in long term. So I had a patient I worked with for a couple of years who always had this sinus congestion. They'd been to, ENT specialists. They talked to an ENT surgeon. Like, there's nothing wrong. They don't have a deviated septum. They don't really, there's like mild chronic inflammation. The answer from the Western medical world was steroids, which they tried and helped some, but not a ton. And I was usually able to get their sinuses to be better for a couple days, and then they'd go back to how they were. This is very frustrating for me. They moved to Salt Lake City, and their sinus problem cleared up immediately. The issue was that they were getting affected by the dampness of the environment that they were in. They had a consistent damp invasion that was creating problems in their sinuses. Once they moved to a dry climate, this went away. When you're in conditions where the external world is, where you're fighting the external world at all times, you're using your Wei Qi to do that. So 2 different people, both exposed to cold weather, the one of them that begins to get truly cold and shivering first is often the one who has the weaker Wei Qi. Over time, exposure is always eventually going to win, and these external invasions are going to get through. An example of a cold invasion would be something like frostbite. We don't really treat frostbite. Yeah, sure.
Yeah, sorry to interrupt. Does just like personal preference for environments play into this? I don't know if you can see someone's preference as like a pathology, but like me, I like cold weather, and I'm always like, I have no energy in warm weather, so I didn't know how that figured in. That's
totally. You're so when your patients report liking certain weather versus other weather, or when patients say things like, "Oh, I can't believe it's summer in New York again," ugh, that's telling you about their constitution, about pathology they currently have, or both. So some people are constitutionally cold weather people. Some people are constitutionally hot weather people. Doesn't necessarily, there's some correlation to where you're born, to your parents, but there's also a lot of deviation. Different people do better with different environments. So the patient I'm talking about who had the sinus issues that were resolved by moving to a dry climate, you're going to have other patients who have skin issues that get resolved by moving to a climate with more humidity. This is individual. We can learn things about the patient from these details. And sometimes these details are pathological. Like here in New York, having patients who are like, I can't stand the winter, I can't make it through the winter. It's like, well, we should probably try to resolve that. But there are other patients who are like, I get sleepy in the summer. It's like, well, we might want to work with that some, but this might also just be who you are. And if it's a real problem, then we can try to find a way to work with it. And if it's just the reality, then that's how it is. Yeah, we're not going to spend much time talking about constitutions and how to think about them. That's something, if you guys are interested in that concept, I'd recommend getting into year 2.5, 3, once you have all this other language down pat and you're comfortable with all these ideas. Beginning to learn about constitution before having a good foundation in Chinese medicine can be challenging because it's very easy to misinterpret how that's talked about. Okay. This making sense otherwise? You guys with me? Good, lots of nods, that's great. Okay, so when we're talking about heat, damp, cold, summer heat, and dry. We're talking about external invasions that are due to the environment being difficult. One of the reasons we don't see a lot of these anymore is because we regulate our environments very thoroughly. So, you know, February, traditionally, you don't get heat invasions in February, but in New York, if you're in a building that has the heat turned up too high, you might start getting heat evils invading you in the middle of winter. Traditionally not an issue. These days, our environment and our seasons and the natural influences and what we actually experience are largely uncoupled from each other. They're separate things. So there's an herb, for example, that's for people who get, no, that's too complicated. We'll get to that later. So all of this, these are all exposure issues. This is all stuff you learn about if you get into backpacking or wilderness related health. We didn't mention wind, so let's spend a minute on wind. When we talk about getting sick, as opposed to say getting sunstroke, when we talk about getting sick, we're talking about wind with something else. And we've got two common ones, wind heat and wind cold. We've got, we'll get to that in a second. Every single disease that you catch through the air is some sort of wind with something else. The coronavirus is largely being called a wind damp, what was the word? Epidemic toxin, for example. Let's start with wind cold. So wind cold was first, wind cold, wind heat, all of this was originally conceptualized, at least in written form, in the Huangdi Neijing, but then these are elaborated on in their own books. So wind cold was elaborated on in the Shanghan Lun, which was written by Zhang Zhongjing. Shanghan Lun means treatise on cold damage. It's one of our main herbal texts, and it created an entire diagnostic and treatment model that we're going to come back to probably more like week 13 and talk about a little bit. Wind heat was written about in a book called The Wenbing. It looks like this is probably a group of people, and this is where we talk about wind heat. How does warm and hot external disease enter the body, move through, and how do we treat it? Also primarily an herbal text, and it also created an entire diagnostic model itself called the 4 levels. So we got the 6 stages with Wenbing. We've got the 4 levels with, 6 stages with the Shanghan Lun, and the 4 levels with the Wenbing. These are 2 of the 4 classic texts within Chinese medicine. There's debate over what texts are classics and not, but these 2 are always on the list. Each of these books charts the entire progression of a disease from getting basically the common cold or a mild flu all the way through to the patient dying, potentially years later, along with how to recognize and what to do at every stage. There's quite a few ideas from the Shanghan Lun that I use regularly for patients with things like chronic fatigue. According to the Shanghan Lun, their chronic fatigue started when they caught a cold some number of years ago. I often can't pinpoint when that is. I also don't really care whether or not it's accurate in that way. The disease that they then describe that this has evolved into is what the patients describe having. Oftentimes a couple of the other stages are there as well, and the treatment protocols described in the book seem to work quite well. Sorry, I'm pushing you guys over the time. Let's see here. Let's pause there and you guys take a break and we'll come back in 10 minutes. Sometimes you guys might have to just go like, Peter, can we take a break now? And just remind me because I can get carried away. So come back at 11:20. We got a little bit more to cover here and then we'll be done for today. All right, we got another 5 minutes, but if anyone has questions, I'm happy to answer them. All right, everybody. Welcome back. We're going to go a little bit further into these classic texts, and then I've got a reading I want to do, and then we're largely done for today. I've uploaded a file into the chat here. I want to introduce this concept to you. It's something we're going to be working more with these ideas a little bit later in the semester. But Chinese medicine has a thing called statements of fact. And it's helpful to know what those are, what that means. Kind of straightforward, but also not. So these are phrases that are considered just true within Chinese medicine. These are foundational concepts. There's no argument about whether or not these are true. There's argument about what they mean, but these are our axiomatic statements. And there's an entire book of them written by Bob Floss. Some of his translation is slightly suspect, but the basic idea is there. And this is an introduction to some of the ideas that we're touching on today. Some of this isn't going to make a ton of sense right now, but I'd like you to just look over it. You're not going to be tested on any of this right now. We're going to do statements of fact for every organ when we go through them, and you will be tested on those. But for now, I just want you to introduce yourselves a little bit to this. So this is reading for between now and next week, and it's in the chat and it's on the Slack. Okay, let's return to where we were, classic texts. Okay, so we've got these two different ways of looking at things, the Shanghan Lun and the Wending, wind cold and wind heat. Between the two of them, we cover pretty much all externally contracted infectious disease. So things like, in this case, we wouldn't be counting things like hepatitis that are viral. Those don't really count as external disease, even the ones that you catch from the outside. Here we're talking about diseases that start with either tightness in the back of the neck or scratchiness of the throat. So wind cold and wind heat, some similarities, some differences. I would like you to be able to know the difference between these two things. So just memorizing these basic lists here. We'll go further into them in the semester, later on in the semester. Wind cold is generally what you get in the winter. Wind heat is what you tend to get in the summer. In summer, often diseases start off with the scratchiness in the throat. That's one of the symptoms of corona that we're concerned about. Wind cold tends to start with tightness in the back of the neck. You can tell the difference once you begin to, like, this is fairly early pulse diagnosis skill set. This is something that most people who've spent a couple months learning how to take pulses can do. Pick up the difference between a wind cold and a wind heat from the pulse. Figure out whether or not someone has an externally contracted disease based almost solely on the pulse. We're very good at treating these things. The common cold, Chinese medicine, we can usually knock this out of someone in under 10 hours with a single treatment. I've had people have their cold or flu symptoms resolve on the table during a treatment. So we're quite good at this. So most of the rest of these evils just become modifiers on wind heat and wind cold. So we'll have wind cold dampness, we'll have wind cold dryness, we'll have wind cold phlegm. Same with all the wind heat. So someone catches a wind cold, they get a cold, but they also feel a lot of distension and aching in their head. Well, that's going to look more like dampness. Wind cold with dryness, same wind cold invasion, but they're also going to have dry itchy skin or a dry mouth or dry eyes. We'll see dry symptoms somewhere. Wind phlegm is a lot of odd diseases, things like stroke or Bell's palsy, sudden paralysis. Again, first pass on this, we're going to go deeper. Just want to introduce you to the ideas. But with what we've covered already, we've covered pretty much all of the box in which disease sits. So let me do this for a minute. That's not what I want to do. You guys see my face on the screen, right? That's not what I'm going for here. Sorry, let me give this one more try. Trying to share my camera so I can write and show you guys something. So let's try second choice. So this is one of the nice things about Chinese medicine. We can do something that Western medicine largely can't do, which is we can say this is the box. And we can title this box all externally contracted disease. And I can also spell. And then within this box, we can start populating it. 6 evils. Wind, cold, damp, dry, summer heat, heat and fire. And we can say that, we can add another one for phlegm, toxicity, and we can say this is basically everything we're going to be dealing with. There isn't much outside of this box. Every now and then you'll get a new concept, and we'll put a little asterisk down here, like occasionally epidemic toxin, for example. But this is basically everything. So if you can think of an externally contracted disease within Western medicine, we're probably going to put it somewhere in here and define it with these terms. Western medicine doesn't do these boxes because they're not theoretically driven in the same way. It doesn't work within that sort of method. When something new arises, there's a long investigation to try to figure out how do we even start talking about this. In the Chinese medicine, using some fairly basic tools, even if you see something you've never seen before, you can go like, okay, I know it's somewhere in this box. I know it's somewhere within this smaller box, and you keep subdividing that, and it helps you get to things that are workable fairly quickly. You may have noticed we haven't talked about summer heat. That's because I've got moderately strong feelings about summer heat. Summer heat is an external invasion, but it's a very different type of external invasion than the rest of them. So someone who, you depending on the patient population, you may or may not see external invasions other than wind cold and wind heat with other things attached. If you work with people who, let's say, spend most of their days working inside of a freezer, then you're going to see patients who have cold invasion issues. If you work with patients who spend a lot of time, if you work with firefighters, you're going to see a lot of heat and dry conditions separate from wind heat. But summer heat, we've largely removed from things we experience, certainly here in New York. If you go down to Louisiana, if you go down to Mississippi or Georgia or northern Florida, you're going to start encountering summer heat. But it's a very different thing than the other things on this list. Summer heat is what happens when it's humid enough that sweating doesn't cool you down anymore. And you get a form of heat stroke. That's it. It's very specific. The rest of these incorporate a lot of different concepts, a lot of different issues. Summer heat is fairly straightforward. We have treatments for it. Watermelon is actually one of the things we really like for this. It's quite effective for getting rid of summer heat. But it's a little bit different from everything else we're talking about. Within general, in Chinese medicine, we care about external disease a lot less than we care about internal disease. In part, this is because if you have good Wei Qi, if you don't have internal disease, if you're balanced on the inside, you generally don't really get external disease. And if you do, you recover quickly. In Chinese medicine, this is how we explain why some people get sick and other people don't. It's not so much a random distribution. You get 100 people in a room, one person has coronavirus. Why do some people get sick and other people don't? In Chinese medicine, we think of this as, sure, there's an aspect of luck to this, but there's also an aspect of what are you bringing to the table that will either prevent you from getting sick or help you get sick worse.
I have one question.
Sure.
Just real quick. So if you get an external disease, is it an automatic assumption that your Wei Qi is weak, or?
It's an automatic assumption that your Wei Qi is weak relative to the disease.
Okay.
So one of the things we're going to talk about this later on in the semester when we talk about how this, like right now we're saying like, oh, if your Wei Qi is weak, then you get sick. We're going to go into much more detail about how exactly that works later. But the basic picture of this is people who, let's say, get sick very rarely with things like a cold or a flu, when they do get sick, it tends to be more severe. That's because they have to have something that's stronger than the Wei Qi for them to get sick in the first place. And often people with very weak Wei Qi get sick in mild ways and in chronic ways regularly. And that's because a lot of the symptoms that we see associated with getting sick are really just signs of the battle being fought between the Wei Qi and the pathogens. So if your Wei Qi is very weak, you don't really appear to be that sick. We see this play out in more extreme cases like people with immune deficiency conditions, where the common cold won't cause them to spike a 103 fever. They'll go up to 99.5 because that's all that their body can do to produce a fever. Most of the symptoms that we have of the common cold are actually our immune system doing its job well. That make sense? Cool. So internal, external, miscellaneous. We have three sources of disease. Diseases don't come from anywhere else. This is our box. Some people might argue that there's others, but this is enough. This is everything. So we have external disease, external pathogens that come in and overwhelm our Wei Qi and enter our body and get us sick. We have internal pathogens. These arise due to how we live our lives. So this is food poisoning, diabetes, back pain. All of these are internal diseases. This is most depression, most anxiety, insomnia, cancer. All of these things are generally internal. So after an external disorder has been around for a while, the line between the two gets blurry. And then last we have miscellaneous, which on an insurance policy would be acts of God. So this is getting hit by a car. This is dog bites. This is like food poisoning is internal disease, but like heavy metal poisoning is miscellaneous disease. It's mistreatment from a physician. It's being prescribed the wrong herbs or medicine. It's surgery and the pain that might linger afterwards. What makes miscellaneous different from external and internal is that they don't have a story. There's nothing we can do to prepare for miscellaneous diseases. These are things that come out of nowhere. The surgery is kind of a mixed example. We as Chinese medicine practitioners can set someone up to be more likely to have good results from surgery, making sure that they've got good circulation in the area, making sure immediately afterwards that we're dealing with the swelling in a way that encourages long-term healing. Like, we don't use ice in Chinese medicine for basically anything, ever. We use herbs that have all the beneficial effects of ice topically while continuing to promote circulation. We don't want that blood flow slowing down, but we also don't want swelling. So we get the benefits of heat with the benefits of ice at the same time with the herbal formulas we use. So there's things we can do for miscellaneous diseases, but there's not a lot of preventative medicine there. And we're going to spend pretty much all of next week going through really the next couple weeks talking about these things and going into more and more detail. So next week, I want you to know the rules for external pathogens. What's an acceptable combo? What isn't? So if I were to ask you questions like, which of the following is not a disease a patient can get? And one of them is wind, damp, dry, then you should put wind, damp, dry as the answer. It's just getting our language together. I want you to know the officials of each organ. You're going to see these on boards and comps, so I'm going to test you on them, and they're going to be on the midterm, and they're going to be a final. And be prepared to explain a little bit about what root and branch diagnosis are. So root is the underlying cause, branch is the manifestation. Lung yin deficiency could be a root, chronic cough could be a branch, for example. Okay. That's the end of our official lecture for the week. Usually there's more questions by this stage, so we're a little bit ahead. I've got another thing I want to cover, but it's it's not part of the official lecture. So let's just take a minute here. Is this making sense for anyone? If you're feeling lost, if you're feeling confused, this is a good time to speak up. If this all makes sense and you're wondering why I'm spending so much time asking people if they're confused, then that's great. But we got space for questions here if you got them.
I have a question
Mm-hmm.
about the organs. Like would you compare? Would you expect like what's the baseline for everyone's organs? Like one person is going to be different than another. As far as like diagnosing, like what's, I don't know, like how do you find that baseline?
But let me repeat the question and see if I've heard this correctly. So you're wondering, given that everyone's different, how do we figure out how to compare different people? Like, so if we're talking about like, here's what health looks like, it's like, yeah, but that's gonna be different from one person to another. So how do we deal with that? Is that kind of what you're asking?
Yeah, and just like, I think it was some point where, yeah, because everything branches out from like when you look at the metaphoric organ, like the channel organ.
Okay, let me open up one of the slides we were looking at earlier and talk about it for 1 second here. Find the right one. I think it's from the first set of slides. We're talking about balance. Yeah, here we go. Okay, so, and if I'm not completely understanding your question, please just chime in and let me know. So this was a slide we talked about earlier today. When we say that we want a person to be balanced, it's not static. So when we're looking at like Western medicine, does a patient have anemia or not? Fairly straightforward question. Well, we've got a hematocrit range. If they're outside, if they're below that range, then they're anemic. If they're on the low side and you go to a naturopath who works with women's health, they might say, well, like, sure, you're not clinically anemic, but we want to boost this anyways. In Chinese medicine, we don't have these ranges. So there isn't a standard baseline that you work with. What we do is we look at the patient, and part of this is gained through clinical experience. Part of this is gained through working with communities. This is one of the reasons people specialize. You begin to understand what baselines look like for individuals. One of the baseline things that we're looking for is lack of negative symptoms. Like if the person is displaying symptoms that reflect that they're out of balance, then that's how we know that they're out of balance. But we want them, things like the constitution of the patient are important. So constitution's everything from your body form. Are you endomorph, exomorph, mesomorph? Are you naturally thin? Are you naturally large? Are you somewhere in the middle? It's, are you a summer person? Are you a winter person? Do you like damp weather? Do you like dry weather? Would you rather, 100 different things. Within the 5-element perspective, we have constitutional typing within the elements. So that's going to tell us things about what someone's psychological proclivities are going to be. It's going to tell us about where they're likely to have health problems. A lot of people get sick in the same way every time they get sick. It's like, oh, I know I'm getting a cold because my head's itching. It's like, that's not standard, but it happens for you every time. So we're learning something about how your system works internally. Over time, and to a certain degree, by the time you're done with school, you're going to be able to tell from looking and talking to someone quite a bit about what their natural balance is going to look like. And it's dynamic. Yeah, I think that's largely answering your question. Do you want to feel free to elaborate on it if I'm like partway there here?
No, I think that like it just matters. I mean, it sounds like you just have to ask, like, do a whole assessment before you can like go anywhere at all with it.
Well, so what we usually do is if a person comes in and they've got pathology present, if there's like a clear disease present, then these questions of constitution aren't necessarily important. We can start off just stripping out what we see right then. And once that's cleared out, it's a question of how far they want to go in working with you. If we're trying to get them fully balanced internally again, then questions of like, of what their personal dynamic balance looks like becomes more important. So this is where people start doing things like eating with the seasons, and like, oh, I'm, I don't know, I'm just feeling kind of sad. And it's like, well, you should feel sad at some points. Like, that's natural and normal. So how much are you feeling sad versus, like, if a patient comes to you and they're like, I never feel anything except wonderful. It's like, well, that's not good. That's worrisome long term. You should be experiencing all the emotions, which we'll talk about next week. So what this dynamic balance looks like varies patient to patient. It somewhat varies practitioner to practitioner in terms of what we see in patients, but it's not necessarily where we need to start. This is a relatively subtle and fine aspect of what we do. Yeah. Let's see. I think it was Amber who had a question earlier. Amber, did I end up answering your question? I told you I'd get to it in a few slides, but
yeah, you answered it in terms of like when people have sort of general, well, like I'm not coming in for a specific reason, but I do have another question.
sure.
You're saying that summer heat is kind of like not really a thing for most people unless you're in that particular environment. So
Yeah.
being that summer heat is kind of the factor in terms of spleen and stomach, does that affect it in any way, the function? Like, does it not get as affected by certain things, being that it doesn't have that? I don't know if I'm like framing the question right, because I don't know what I exactly trying to ask.
Let me repeat this question back to you and see if I get what you're saying. So given that summer heat is related to earth, the spleen and stomach, what does that mean? Like, why, how is it engaged with the earth? Is that about right?
Yeah.
So in this case, this is mostly related to fluids within the body. Summer heat is largely a fluid disorder. So symptoms of our summer heat at a basic level are the patient sweats, feels like they have a lot of heat inside, and stops urinating. We treat them by unblocking the urination. That's the name of the treatment principle for summer heat and releasing the exterior. And we use things like watermelon to help promote urination for these patients. Cucumber works, basically everything you think of as it's hot, you're in the south and it's summer, vegetable stuff. And so what does that have to do with the spleen and stomach? The spleen and stomach are considered the source of fluids within the body. So as your digestive organs, if we want to get fluids into the body and we want to also help the person urinate, we're going to be working through there. Oftentimes people who get summer heat also get bloated, like physically edematous, because fluids aren't moving well. And as you're working with this, those fluids also drain out. So I don't think it's wildly connected to the earth, but we do see issues show up in the spleen and stomach. Contrasting that with heat and fire conditions, for example, someone who gets an external heat invasion, we often see that affecting the heart in terms of increased pulse rate, or if it's long-term and really serious, decreased pulse rate, and shifts in mental emotional nature. Like, I don't know if you guys have experienced this, but if you get overheated for an extended period of time where you're living in just hot weather, it can often make, at least I'll speak just for me, I find myself thinking a little bit less clearly and having more chaotic thoughts. The heat just starts to get your brain a bit. On the flip side of cold, you get the cold invasion, it affects the kidneys. People tend to slow down, they tend to shrink a little bit, and they tend to get more physical pain with long-term cold exposure, especially low back pain, all of which is going to be kidney and water related. Does that make sense?
Yes, thank you.
Yeah, you're welcome. Yeah, please.
Okay, I have a question. Yesterday, or not yesterday, but last week when we were looking at the chart of the 5 elements with Earth placed in the center rather than placed in the, I looked that up. I just found that the diagram that most closely resembled that was by Giovanni Macchioccia, which I'm not familiar with his work too much yet, but I just was going to ask about that and wondering if that has something to do with why summer heat and earth. I don't know if those two things are related at all, but I'm wondering why the diagram is different sometimes when you place earth at the center and have the sort of 4 directions. Is that just to depict it, or Does it?
Yeah, I mean, why is the celestial cross something that we care about? How is it different is one of the questions I'm hearing you say.
Yeah.
And the other one is, does the fact that Earth is in the middle mean anything in relation to summer heat?
Yeah.
So these images are all heuristic tools. You know, the 5 elements set up as a pentagram, it's there because it's useful. It's not true in the way that gravity is true or in the way that this table that's here is true, but it's useful. If we use these tools, if we incorporate these tools, then we can do a better job of helping people achieve their health-related goals. And the pentagram organization tells us a lot about how to work with pathology, but it doesn't tell us anything about how health works. It tells us about how problems work. So it's more pathophysiology there. The celestial cross tells us more about how physiology works, how health works. So when someone's healthy, we're looking more at the celestial cross. We're like, okay, so if we're looking more at balance, often we're looking more at the celestial cross. So the Earth being in the center, it's holding the circle together. We're going to talk a lot more about this when we get into the emotions, because that's where it begins to matter. Maciocia has this image in his Foundations of Chinese Medicine book, which is where I got most of these images out of, because, well, frankly, the Weissman book doesn't have good images. I don't really like Maciocia's work that much. We desperately need a new intro textbook. I know multiple people who are working on these books, but all of the intro textbooks are outdated. Not in terms of Chinese medicine, but in terms of Western understanding and English understanding of Chinese medicine. We're doing some very interesting work as a profession in the West of reviving pre-communist China Chinese medicine. So some of that's starting to come into these other works as well. In terms of summer heat and the celestial cross, I wouldn't think too much about that. I really want you guys to take summer heat and like put it off on the side a little bit. Dampness is the main pathogen you want to think about with Earth. That's the one that matters the most. It's external, it's internal. Like all of the pathogens except summer heat have an external and an internal version, and then summer heat's just off on the side doing its own thing. Dampness and Earth being in the center, it gums up the entire system. It slows it all down. We're going to talk about dampness in detail in 2 weeks, but it's like putting chewing gum into a machine. And so when we look at the celestial cross and dampness helps us understand through its effect on Earth how that affects every system immediately. That make sense?
Yes.
Some sense.
Yes, thank you.
You're welcome. Okay, I think we got time for one more question if anyone has one, and then I've got a little bit of a reading to do, and then that's about it for today. Okay, we're just gonna go right into this. So there's an author that I think can be nice for people who are near the beginning of their medical educations to read. I mean, or people who aren't near the beginning of their medical educations. Oh, don't tell me I took this in the clinic. Okay, great author whose book I don't have to show you right now, named Richard Seltzer. He wrote a number, oh, here we go. No, that's also not his book. Okay. He's written a number of books. I'll just pull up an image here. And I'm going to read you guys a story from one of his books, Mortal Lessons. They're all books about he was a surgeon. He was the head of surgery. He was the chief of surgery at Yale. And he wrote a bunch of books in part to help educate people coming up, but also to just share his thoughts and his experiences over the time he worked. So, you know, he's got, some of them are tear jerkers, some of them are kind of poetic. He's not always the best writer, but there aren't a lot of books that are readable for a layman who doesn't have a lot of scientific language yet, about that really go moderately deep, at least, into the experience that clinicians have. While often the Western medical language isn't that useful to us, a lot of the experiences that clinicians have, regardless of where they work and what specialty they work in, are applicable to every other practitioner. So I want to read a story of his to you guys, and I will put this up in the chat as well. So this is an excerpt from his book, Mortal Lessons, Notes on the Art of Surgery from 1976, at which time he was, I believe he was a resident, maybe chief of residence at Yale Medical School. On the bulletin board in the front hall of the hospital where I work, there appeared an announcement. Yeshi Dondon, it read, will make rounds at 6 o'clock on the morning of June 10. The particulars were then given, followed by a notation. Yeshi Dondon is personal physician to the Dalai Lama. I'm not so leathery a skeptic that I would knowingly ignore an emissary from the gods. Not only might such sang-froid be inimical to one's earthly well-being, it could take care of eternity as well. Thus, on the morning of June 10, I joined the clutch of whitecoats waiting in the small conference room adjacent to the wards selected for the rounds. The air in the room is heavy with ill-concealed dubiety and suspicion of bamboozlement. At precisely 6 o'clock, he materializes, a short, golden, barrelly man, dressed in sleeveless robes of saffron and maroon. His scalp is shaven, and the only visible hair is a scanty black line above each hooded eye. He bows in greeting while his young interpreter makes the introduction. Yeshi Dondon, we are told, will examine a patient selected by a member of the staff. The diagnosis is as unknown to Yeshi Dondon as it is to us. The examination in the patient will take place in our presence, after which we will reconvene in the conference room where Yeshi Dondon will discuss the case. We are further informed that for the past 2 hours, Yeshi Dondon has purified himself by bathing, fasting, and prayer. I, having breakfasted well, performed almost only the most desultory of ablutions, and given no thought at all to my soul, glanced furtively at my fellows. Suddenly we seem a soiled, uncouth lot. The patient had been awakened early and told that she was to be examined by a foreign doctor, and had been asked to produce a fresh specimen of urine. So when we enter her room, the woman shows no surprise. She has long ago taken on the mixture of compliance and resignation that is the face of chronic illness. This was to be but another in an endless series of tests and examinations. Yeshi Dondon steps to the bedside, while the rest stand apart, watching. For a long time, he gazes at the woman, favoring no part of her body with his eyes, but seeming to fix his glance at a place just above her supine form. I, too, study her. No physical sign nor obvious symptom gives a clue to the nature of her disease. At last, he takes her hand, raising it in both of his own. Now he bends over the bed in a kind of crouching stance, his head drawn down in the collar of his robe. His eyes are closed as he feels for her pulse. In a moment, he has found the spot, and for the next half hour, he remains thus, suspended above the patient like some exotic golden bird with folded wings, holding the pulse of the woman beneath his fingers, cradling her hand in his. All the power of the man seems to have been drawn down into this one purpose. It is palpation of the pulse raised to the state of ritual. From the foot of the bed where I stand, it is as though he and the patient have entered a special place of isolation, of apartness, about which a vacancy hovers, and across which no violation is possible. After a moment, the woman rests back on her pillow. From time to time, she raises her head to look at the strange figure above her, then sinks back once more. I cannot see their hands joined in a correspondence that is exclusive, intimate, his fingertips receiving the voice of her sick body through the rhythm and throb she offers at her wrists. All at once I am envious. Not of him, not of Yeshi Dandan for his gift of beauty and holiness, but of her. I want to be held like that, touched so, received. And I know that I, who have palpated 100,000 pulses, have not felt a single one. At last, Yeshi Dandan straightens, gently places the woman's hand upon the bed, and steps back. The interpreter produces a small wooden bowl and 2 sticks. Yeshi Dandan pours a portion of the urine specimen into the bowl and proceeds to whip the liquid with the 2 sticks. This he does for several minutes until a foam is raised. Then, bowing above the bowl, he inhales the odor 3 times. He sets down the bowl and turns to leave. All this while, he has not uttered a single word. As he nears the door, the woman raises her head and calls out to him in a voice at once urgent and serene. "Thank you, doctor," she says, and touches with her other hand the place he had held on her wrist, as though to recapture something that had visited there. Yeshi Dandan turns back for a moment to gaze at her, then steps into the corridor. Rounds are at an end. We are seated once more in the conference room. Yeshi Dandan speaks now, for the first time, in soft Tibetan sounds that I have never heard before. He has barely begun when the young interpreter begins to translate, the 2 voices continuing in tandem, a bilingual fugue, the one chasing the other. It is like the chanting of monks. He speaks of winds coursing through the body of the woman, currents that break against barriers, eddying. These vortices are in her blood, he says, the last spendings of imperfect heart. Between the chambers of her heart, long, long before she was born, a wind had come and blown open a deep gate that must never be opened. Through it charged the full waters of her river, as the mountain stream cascades in the springtime, battering, knocking loose the land, and flooding her breath. Thus he speaks, and is silent. May we now have the diagnosis? A professor asks. The host of these rounds, the man who knows, answers. Congenital heart disease, he says. Interventricular septal defect, a hole in the wall between the left and right chambers of the heart, with resultant heart failure. A gateway in the heart, I think, that must not be opened. Through it charge the full waters that flood her breath. So, here then is the doctor listening to the sounds of the body to which the rest of us are deaf. He is more than doctor, he is priest. This occurred while Seltzer was chief resident in surgery at Yale. So we've spent a bit of time today talking about metaphors and how to talk about the body in different languages. This is one of my favorite examples of a Western practitioner encountering someone who does this and getting it.
Peter.
Yeah.
Donna Ma had given that to us. I think it was right after Yeshi died. Didn't he just die a year or 2 ago?
Oh, I'm not sure.
Or someone wrote an article just after he died, and then she required us to read the article. And it was so touching and profound because it's an inspiration of where we can like seek to be at that level of the subtle, like get so quiet and pure and clear and clean to know that at that level. And then also when I first read it, so overwhelmed that maybe I would like the quest to get there. The road is long, and the practices that it would take, like he said, he had been up for 2 hours doing all those practices to get clean and clear, all those spiritual practices, like what it takes to get there, to have that such intuitive knowledge. But to sit with someone like that visualization of him hovering and just taking the pulse for that long. Such an inspiration, but I remember feeling so overwhelmed.
I mean, I feel that same way sometimes about that story as well. It's certainly, I don't know if it's necessarily an aspiration, but it's a reminder that this medicine can go a very long ways. This is the Tibetan version of it, but a lot of the underlying philosophy is the same idea. And there's a lot that can be done, and even things as simple as taking the pulse can reveal a surprising amount about people. I hope you guys enjoyed that. Look over the information, make sure you memorize which organs and which officials go together. Make sure you know the different evils, the external disease. And I think I'll see you guys next week. I'm going to hang out for 10 minutes here. So if anyone has questions, feel free to stick around. This is the class is over and we chat up by the whiteboard sort of a thing. But everyone else, you're free to go. And I'll see you next week. Take care.
I kind of would like to just piggyback on my last question, if that's okay.
Sure.
The arrows in the celestial cross also kind of move in and reference Earth and then move back out. And sorry if you're having to repeat yourself about these things. I'm just wondering, is there, when it moves in and comes back out, is that kind of how dampness affects the rest of the system in sort of this referential way, or is that just?
Yeah, I wouldn't think about it too much in that way. We're gonna go a lot deeper into this. I think it's next week. I've done some reformatting, so I'm a little off on where things are week to week right now. So the basic idea is that one of the things that Earth is that Earth is that which harmonizes transitions. So anytime you're changing from one thing to another, Earth is the thing that makes that transition possible. So there's like mid-spring, which is definitely wood, and there's midsummer, and that's definitely fire. But there's that period of time where it's like, I don't know if it's spring or summer yet. That period of time is Earth. If you have a patient that comes in and says, I get sick every time the seasons change, that's an Earth pathology. And those arrows that come back to Earth, that's reflecting the fact that we don't have an Earth season. That whole late summer thing, not really. It's more that we have depending on where you live, seasons are different. If you go down to Central America, they've got 2 seasons, raining and not raining. But here in New York, we actually have 4 seasons, which is great. And the transition point, like we're kind of in the transition from summer to fall right now. It's like you go outside, you don't know if it's going to be summer or it's going to be fall in any given day.